Allow us to have another day to praise you and see your glory. Thank you for the love and protection, especially this time of pandemic. Bless us, Father, with your wisdom as we begin our class. Help us to focus our hearts and minds on what we are about to learn. Inspire us by your Holy Spirit as we think and listen. Guide us by your eternal light as we discover more about the world around us. Lord, we thank you and let your will be done in our lives. We ask all this in the mighty name of Jesus. Amen.
You are holding on to that dream. You have a choice today to go up or stay down. Now is the time to take the first step to the top. With quality review materials that produce born top-notchers and thousands of board passers across professions.
Today, let's discuss
In dynamic, innovative, and interactive review delivery. Ensuring an excellent, balanced, relevant, and comprehensive review experience. Extending support beyond review and celebrating victories together as one family. What you choose today determines your success, so make that powerful decision.
Welcome to the top.
Choose to be the top with Top Rank.
So one thing na na-help sa akin ng top rank talaga is that confidence. Nung pumasok ko, yun talaga yung hinahanap ko sa top rank eh. Kasi I always question myself. And yun yung nagiging breaking point ko lagi. Imagine all those exams na every time na sobrang hirap, you try even harder. Tapos next exam, mas mahirap ulit. So you try harder again. So by the time na mag-PNLE na, parang, okay, give it to me, I can do it.
Very holistic po sila approach. Hindi lang po mentally, ano rin po sila sa physically, spiritually, and emotionally po. Tulad po sa stress management na po.
Sa top rank kasi, na-realize ko, there's so much more to learn. Every single day na nakaupo ko sa harap ng lecturer sa top rank, they've given me knowledge na nakuha nila from their experiences as nurse. Iba kasi yung top rank, parang pag naririnig ko siya, very, very welcoming. Tapos yung lecturers, very engaging sa students. And then, ayun, parang everybody really cared na kailangan makapasa tayo. Nagmo-motivate kami sa isa't isa. And then, ayun, basta pag top rank, iba talaga siya. As in, ibang level. So, never ako nag-regret na nag-top rank.
Naniniwala po ako na lahat ng student may potential. Top rank was there to harness me to the fullest extent of my abilities. From giving me top-notch lecturers, top-notch materials, environment, it never came short of providing me what is the best there is for me to improve myself and to help me achieve this goal.
Top rank po kasi mag-e-enjoy ka talaga. Ang naging review ko po sa top rank is fun, enjoyable, habang natututo ka ng maraming learning. So, minsan gigising ako in the morning, parang tinatamad ako, bad trip ako, ganyan. Then, ma-realize ko, ay teka, funny yung prof ko Parang gusto ko ma-enjoy tong araw na to. So, ang gagawin ko, papasok po ako ng top rank. Then, uuwi ako, good vibes na ako. Ang dami ko pang natutunan.
Out of everyone na nag-take ng board exam, ako po yung top 1. Hindi pa rin po nagsisink in totally. Bali yung mom ko po yung pinaka-inspiration ko po. Kasi siya po yung reason kung bakit gusto ko po maging successful.
Sobrang proud ako na hindi ko ma-express yung feelings ko kung ano yun. Na hindi nga, that night hindi ako nakatulog. Pero ngayon, the same pa rin, para pa rin akong naka-float. Kala ko sa TV ko lang mapapanood. Na naranasan ko pala ngayon na kahit sa kabila ng mga experience mo ng mga hardships, meron din pala talagang hope na pwede kang mag-top of all.
Thank you po. Thank you. Hindi ko po din akalain na magta-top 1 ako, pero sa tulong po ng top rank, nakamit ko po.
Of different schools we start, with a single name written apart. The clash of battle is sweet to hear. Right now when the victory is near, excellence is our only standard to outshine the rest. With a great mind and compassionate heart, trained us to be the best we can be. All that we learned at Top Rank Review Academy, we shout with pride and heads up high as victors our dreams shall soar to the sky. Trained us to be the best we can be. Soar to the sky. We learn that you want the Top Rank Review Academy. Soar to the sky.
as fruitful as it was yesterday, no? Again, we will reserve some time for our question and answer para akong si Fast Talk with Boy Abunda or something else. And we will try to answer queries as much as possible. You just type them over. Maybe if si Ian ba, Marge, darating hindi? Feds lang. Marge. Nawala na. At any rate, please type them on the chat. Okay, para later on, I will go through them and see what we can do to discuss. So what is most important is that the concepts are reviewed, and I hope there will be new learnings, just like what yesterday. Now, these new learnings as well as the concepts that we will be reviewing will definitely help you, guide you, no, in choosing the best answer. Remember, in the board exam, some choices are all correct, some choices are all wrong. You just need to choose the best answer that fits the question. So, depende sa question, ha? Sige. So, if you have now your material, now this is our working material for today's session, as well as hopefully tomorrow. Now, I will be discussing concepts as we answer the questions, okay? When I discuss, okay lang na paulit-ulit. Ang importante, when we keep on repeating and repeating, it becomes part of our, tawag nito, of our brain, no? It becomes part of our stock knowledge. So number one, if you look at number one, in labor and delivery care. So pumunta ka agad sa central area of maternity practice, which is labor and delivery. Okay? The nurse must be competent in all areas. So competency, paki-underline nyo ang competency. So your concept is as on labor and delivery competencies, no? Which one is an exception? So here is now a question that is asking you to identify the wrong statement, the wrong answer, and the non-competent aspect of care in labor and delivery. So all of these were discussed yesterday. IEs were discussed. Okay, so are they supposed to be part, no? Performing, is that supposed to be part of your competency? Yesterday I said yes. If you're going to be part and parcel of the labor DR delivery team, one of your initial competence should be performing internal examinations. Now, let me just give you one standard in performing the IE. Please take note, no? Our standard is the nurse, or I will now go into generality of skilled birth attendant, no? The nurse or the skilled birth attendant must not perform or more than 5 internal examinations throughout labor. Ayan ha, ang binigay ng POGS, Philippine Obstetrical and Gynecological Society, which regulates or which guides the practice of obstetrics in the Philippines, wag lalampas ng 5 ang pag-a-IE natin sa ating mga patients. Why? Number one, of course, there are several side effects of internal examination. One, if you're not good at IE, number one, you can more or less, no, injure the cervical canal, injure or create some damage, no? You can harm, okay? Masusugatan mo yan. So that's one, no? Kung di ka marunong. Pangalawa is, this is not in any order, no? The second is, you can rupture the amniotic bag. Okay? So you can rupture the amniotic bag prematurely, especially, no? So that's one, you should not. So what is one of the things that we teach our nurses and midwives when we train them? Do not IE during a contraction. Clear? So pag nag-IE kayo, wag yung umiiri ang nanay. So remember, always tell the mother, take a deep breath, hinga ng malalim, misis. Okay? I-assess ko lang kung gaano na kalaki ang iyong cervix. Ganun na lang. It's Taglish, no? Naintindihan naman ng nanay yan. And so she will need to relax and deep breathe. So you do the IE. Now, one of the major effects, if not the only effect na kino-consider sa practice, aside from what I mentioned, is the possibility or the risk, the high risk for infection. So if if there is a question on vaginal exam which says, what is the major side effect of doing or performing internal exam in labor? Ang isasagot nyo palagi, even if tama yung mga iba, is the risk for infection. And that's the reason why ang standard is not to go beyond 5. Ang kaso, what happens in a government hospital like my hospital? Papasok si intern, mag-a-IE. Papasok si student midwife, mag-a-IE. Pangalawa na yan. Papasok yung clerk, mag-a-IE. Papasok si nurse, mag-a-IE. Papasok si doktor, mag-a-IE. Labor room pa lang or ER pa lang, nakalima na. So that it does not stop there, no? It goes beyond up until the delivery room. So what happens is lamog na yung puwerta at yung cervix ng ka-AEN. No matter how sterile your you believe your procedure is, naka-sterile gloves ka na. The minute pinasok mo ang 2 fingers mo na ito, okay? Remember I told you yesterday, the vagina is a haven of microorganisms. So pag pinapasok mo palang, kumakapit na. The microorganisms will now attach itself into the fingers, the sterile gloved finger, and you yourself will be the one to put those bacteria inside the cervical canal. And so you develop infection. Okay? Kaya dapat marunong at mabilis kayo. So that's one, competence, no? Now, the use of partograph. Again, yesterday we had some slides on the partograph. We know that so far the best tool to monitor labor is to use the partograph because it is very, very graphic. Remember that in labor, when we use the partograph, we are monitoring the progress of cervical dilatation, primarily for the mother. But please do not forget that the fetus is also a patient. Now, if the fetus is a patient, you need also to monitor the fetal heart rate. In the partograph kasi that we are using, medyo hindi na focus ng husto ang fetal heart rate. It is part and parcel of the maternal and fetal assessment down below in the form to be written sa boxes. Unlike the cervical canal na talagang nakafocus with the graph, with the colors, no? And of course, with emphasis on how the cervix progresses. Okay? So, the use of partograph is to determine actually primarily cervical dilatation and of course other maternal and fetal aspects. Okay? Is that a competency that should be mastered by the maternal and child nurse? Yes. Again, I am telling you at this point, sinasabi ko na may bago na po tayo na monitoring tool in labor. This was promulgated in 2018 by WHO. The DOH has not adopted because training of the SBAs or the skilled birth attendants was not done because of the pandemic. But recently, we started in Fabelia, we had our BMOC training simultaneously with our nurse certification program, and they have started to introduce this form. Anong klaseng form ito? The labor care guide, which is more specific, and it includes now the equality of the fetal heart rate and the cervical dilatation. So antayin nyo na lang yan. Pero ang nakabank ngayon sa examination banks of our examiner is still the partograph. Okay? Next is we go to suturing all lacerations. Okay? Now, suturing all lacerations is suturing a skill. Yes. Yes. Now, if you are a DR specialist, DR nurse, skilled birth attendant, part of your competence is suturing lacerations, no? Because you need to suture the lacerations that you incur while delivering the babies. Kaya lang, okay, na of course, letter D is moot and academic. Handling normal deliveries is really part and parcel of your skill. So, an exception here is anong letter? Paki-type nyo nga. Just let me see the chat. Sige. Anyone, please type which is your best answer here, which is an exception. Okay, perfect. All of you have stated that C is the answer. Why? What makes C the wrong answer? Okay, because of the term all. Very good. Can I just mute myself? Sandali lang ha. Very good. All. So that means to say, alam nyo na ang concept. The nurse and the midwife, ha? May I reiterate and emphasize, the nurse and the midwife are only allowed by law to suture first and second degree lacerations. Ang third and fourth and episiotomies can be sutured only by the physician. Now, baka akala nyo ang midwife kasi nag-e-episiotomy yan at saka nagsusuture yan ng episiotomy. Nag-e-episiotomy yan. Baka akala nyo that is legal sa kanila. Hindi. Whatever is legal sa midwifery, ganun din sa nursing. Pantay lang yan. Okay? So again, when we talk of all restorations, paki-encircle yung all na yan. Okay? Take note that the third and the fourth degree lacerations are not included. And so, what are the muscles that the nurse can suture? First, you can suture your perineal muscles and you can suture your bulbo-cavernous muscles. Bulbo-cavernous muscles are the muscles surrounding the vaginal canal. So, can the nurse and midwife do that? Yes. Ano ang hindi pwedeng isuture ng nurse and midwife na muscle? Coccygeus muscles. So, by the term coccygeus, it goes far beyond, no? Far beyond your sacrum, it goes down below your coccyx. And this is already a very, very deep laceration. Okay? So do not suture deep and tawag nito deep lacerations because it can create hematomas and it can create problems or bleeding. Okay? So wala na tayong away dyan ha. You can suture. By the way, in suturing, when you suture, usually these are the cues, no? You suture 1 centimeter above the suture, the laceration. So you suture 1 cm above in order to catch the beginning of the laceration. You do not suture on the beginning of the laceration. 1 cm above ang cue natin before we bite. We take the first bite. And then today we are using the polyglyconic suturing material. We are being discouraged to use the chromic sutures. Chromic O, Chromic 2O. Previously kasi we were using Chromic 2O. Dinidiscourage na yan ng POGS kasi chromic sutures have been found to be prone to infection because they come from animal intestines. No? The source of these chromic sutures come from animal intestines, which is highly prone to infection. So we use a polyglyconic suturing material, which is absorbable. And of course, narinig nyo na yung suturing material known as double arm, yung mahabang sinulid, polyglyconic material with 2 needles at the edge. 1 cutting needle and 1 round needle. So the round needle is used for internal tissues and the cutting needle, on the other hand, is used for the external skin tissues. Okay? So we use double arm. Example lang ng brand as well as Vicryl. Vicryl. So we do not anymore, remember that our sutures should be absorbable. Hindi yan na binabalikan ng nanay para para tanggalin ang sutures. Okay? So clear tayo. Ito lang ang cue ko. This is my cue, no? When you are in your own clinics in the community and you see lacerations, you can naman assess your skills. Can I do this? If you believe you cannot, then don't. Because our biggest problem if we malfunction in suturing lacerations is the presence of hematomas. Hematoma, malaki. we have a case, no? Meron kaming nakitang hematoma dinala sa ER namin as big as santol, no? Nakasalpak sa may bulbar area, sa lower part near the anus. And then when we removed it, when we removed the blood, we were able to evacuate more than half a liter of blood, no? Sabi nga nung doktora, naku, halos mapuno yung coke litro. And then if hematomas are seen at the suture lines, that means to say that hindi na suture ang malalim na blood vessel, which bleeds even if the exterior part is sutured. Okay? So, ayan. Okay. Now we go to handling normal deliveries. Mamaya na natin pag-usapan yan, ha? Okay, number 2. A type of vaginal infection characterized by, please underline, foul, grayish. So we are now identifying the characteristics of your discharge. And of course, yesterday, we identified each of the characteristic of the discharges or of the of the infections. And your answer is, okay, let me meron akong nakita. I would like to react on that. So, yes, your answer is letter A, bacterial vaginosis. Gray siya, mabaho siya. Yung letter B, creamy to greenish na napakabaho. Clear? So, kasi I see A and B answers. The correct answer, because it is gray, is letter A. But there is a commonality, which is the foul odor. Now, trichomoniasis is greenish to creamy, creamy to greenish, and may isa pang karakteristik na wala sa bacterial, foamy, medyo mabula-bula. Now, I saw here a comment which I would like to react to and answer. Ito. Yung episiotomy na daw, di na daw masyadong, yes, okay? No. Yung episiotomy, di na daw masyadong ginagawa. May I just say, true. Episiotomy is now indicative, okay? So it is na, or, indicative. Hindi lahat ng priming ngayon kinakat namin. Okay? Pero mali yung rational na same lang daw po ang healing kasi no. The reason why this is part of the EIC, Essential Intrapartal Care for the second stage of labor. We only do episiotomy if we believe that the vaginal canal is tight. So we only do episiotomy pag medyo makipot. Makikita mo naman yan eh. There are already evidence-based researches as well as cases na meron na tayong mga number of primies na kayang-kayang maglabas ng baby kahit walang episiotomy. Only a few abrasions or a first-degree laceration. Why? Because episiotomy is difficult to, episiotomy is most uncomfortable. Clear? Most uncomfortable, 2-3 linggo kang maghihil, hindi ka makakaupo masyado, masakit. Especially if the episiotomy is a mediolateral, left or right. Are we clear? So, ngayon, hindi lahat ng priming kinakat namin. Ina-assess, and then if we think that the woman can deliver without an episiotomy, then we do so. Unlike nung time ko, SOP, basta priming, kinakat namin. Kahit premature nga, kinakat eh. Okay? So, that is one, how do you call this? Update on the use of episiotomy. Okay? Sige ha? So, we will be discussing that as well when we go into the EIC. Now, we're done ha? So, letter number 2, I would just want you to master the characteristics and of course, the treatment. Antibiotics, okay? Then you have your tawag nito, clotrimazole, and then your metronidazole or your flagyl. Okay. Next, number 3. Which among these statements, again, is not true? And circle din na true about infertility. Foamy is for trichomoniasis, ha? Okay. So, which among these statements is not true about infertility? A, B, C, or dog? Anong sagot? Chat. Anong sagot nyo? A, B? Alam mo, napakadali nito. Pero in one class, ang daming nagkamali. Okay? Ayan. Ayan. Okay, so I see answers here na iba-iba. Okay? The best, of course, not the best. The only answer, the best answer is of course letter A. Look at the question. Infertility is the inability to become pregnant, underline the word within 12 months of unprotected regular sexual activity. So that is not true. I said infertility is done or is usually defined as inability to become pregnant after 12 months. So kung hindi ka mabuntis within 1 year, hindi ka pa infertile. Okay? Letter B is true. May be caused by irregularity or of menstruation. Letter C is true. Pelvic infections can cause infertility. And letter D is true. It can be initiated by endometriosis. The endometrial cells, no, that gets out of the uterus can block the fallopian tubes, which may not allow the passage of your fertilized ovum or even of your sperm. Okay? Sige. So yan ha. Next, number 4. We talk about the number 1 cancer in women. And this is breast, no? And this is the ang ano sa breast, one very important factor in the breast cancer is it can recur. It's one of the cancers that can recur, but it is also reversible. So parang ibang answers yan, once treated ka, pwedeng wala na. But you have to be monitored regularly to prevent recurrence. Another is the risk of cancer, particularly the breast, increases with age. And that's the reason why when you reach the age of 40 ha, and if you have a high familial tendency, genetic, nanay mo, kapatid mo, pinsan mo, tiya mo, nagkaroon ng CA, then we would require you to undergo letter B, mammograms. So mammogram is still the best way to detect, no, cancer of the breast. Okay? The monthly breast exam is not tawag nito, it is not really a very good detection scheme or strategy. However, it is a good way for the woman to become aware of her become aware of her body and to be very alert for any abnormality in her breast. Any lump in the breast may suggest, no, may suggest breast cancer. So for those who are familially, those with familial tendencies, at 40 years old, we already asked them to undergo mammography. For the regular women, we usually suggest 50 years and above. Merong ang Safe Motherhood International meron silang parang guide that if you are negative for the first 3 years of mammography, you can skip and make it every other year, and if negative pa rin, you can do it every 5 years or so. Okay? So yung isa pa na high risk for for breast CA, aside from familial tendency, aside from increasing age, kaya we are mandating a mammogram at 50 and above, is it is common, more common sa mga babaeng may dense breast. D-E-N-S-E, dense. Okay? Malaki at malaking suso. Malaking suso. More prone siya. And then they said last time na ang pain daw in the breast does not suggest the possibility of CA. However, if it is frequent, kasi merong mga, of course you know that there is a pain every cycle. Meron yan. Especially tender yan, masakit yan. But if the pain becomes persistent, becomes throbbing pain, then I would suggest that you see the doctor immediately and have the mammogram. Walang ibang makakatulong sa iyo kundi yung sarili mo. So be very, very keen about assessment of the breast. So your best answer is letter boy. Now, there is now a latest procedure known as mammotone biopsy. Now, this is done through a machine wherein the machine sucks, the machine sucks at the tissue, and this is done usually if they believe that it is not cancerous and that ang tawag to, it is just a cyst lang siya, benign, then they can remove the small cyst by means of a mammotone machine. Yan ang latest ngayon. Okay? Pero if they believe based on the mammography na it is invasive, na kumalat na, then they would do an actual biopsy. They would do an actual biopsy not using the machine. Okay? Now, breast ultrasound is the partner of mammography. So they can first do the mammography and then the ultrasound. Okay, later. Because breast ultrasound sometimes cannot identify the tumor. It is the X-ray that will actually identify the tumor. Okay? Sige. Okay. Next, number 5. Oh, by the way, those are your cancers, ha? Now, let's go back. Paulit-ulit na naman para hindi na natin ulitin. Cancer of the cervix is the most preventable now because of the vaccine. So, yung vaccine na yan is given to specifically and ideally high school, yung mga 12, 13, 11, yung wala pang coitus. Because definitely, cervical CA, which is brought about majority of the time by HPV or the human papilloma virus, is sexually transmitted. So doon sa mga wala pa, that is the ideal way, that is the ideal time na binibigay namin. So for those who are normal, we give them, usually, ang dose is twice, Twice. Para yung para yung COVID, tawag to, para yung vaccine na 3 times, So twice. But if you are immunocompromised and at risk, they give it 3 times. Okay? Now, we do an assessment regularly for sexually active women, and this is your cervical pap smear. So, pap smear is done, okay, with the use, of course, of your reagents, and this is done with laboratory machines. Pero sa community kasi, pag walang machine and you just want to screen women, may ginagawa ang midwives na itinuro sa kanila ng DOH, And this is your acetic acid cervical assessment, Acetic acid, suka lang, ipipaint nila dun sa cervix. If there is a change in the cervical appearance, then they put that woman on one side and then later on suggest that she goes for actual examination in a hospital setting. Okay, so your vaginal acetic acid test. Okay, so yan. Now your myomas, your ovarian cancers are best seen, by the use of ultrasound. Welcome. Okay, basta walang coitus, walang sexual intercourse, they can give definitely the vaccine, the HPV vaccine. Okay? Sige. Next, let's go to number 5. Ito na. Ito na yung madugo. Madugo na topic. What is the topic? Menstruation. Menstruation. Okay? Okay, so let's talk about menstruation. Isa pang madugong topic will be the pelvis. So, what about menstruation? Okay, you know very well that menstruation is part of the reproductive process in a woman. Babae, ha? So, what are the reproductive processes na nakikita or manifested by a woman? Number one, definitely, okay, will be ovulation. Next will be menstruation. The third will be fertilization. And the fourth will be implantation. And the fifth will be pregnancy. Okay? Number 4, ha? Number 4 is letter boy, regular mammography. Okay. So these are the reproductive processes that is found only in a woman. Ovulation, menstruation, fertilization, implantation, and pregnancy. Hindi ito nakikita sa lalaki, of course. Okay? Now, among the 5, ovulation cannot be done artificially. Okay? Fertilization, menstruation cannot be done artificially. Only fertilization can be done artificially. Okay? Outside of the body. When I say artificial, pwede itong gawin ng wala sa katawan ng babae. Okay? And then implantation cannot be done artificially, and pregnancy, of course. Okay? So among the 5, ang pwede ngayon na igawin outside of the woman's body, everything, yung 5 na yan, nagagawa sa katawan ng babae. Okay? But however, kung talagang hindi magawa yung iba, then they go into the third, which is fertilization, na pwedeng gawin sa test tube or sa petri dish. And then, after it has fertilized, at saka ibabalik through by implantation. I-implant uli doon sa desidua ng babae para lumaki at maging progressive ang pregnancy. Okay? So let's go first into yung una, ovulation. Concept sa review lang. So ovulation ang concept. 1. Ovulation occurs 14 days before the next period, hindi after. Okay? So if your menstruation is May 1, do not say na I will ovulate on May 15. Kasi that will be the 14th day or May 14. Pero if you know that your cycle is 30 days, isubtract mo lang yung 14 so you get your presumably actual date of ovulation. Ha? So ovulation occurs 14 days before. So ang ovulation also varies every cycle. If your number of days per cycle changes. Okay? So, if 26 days, minus 14 mo yan. Kung 28 days ang cycle mo this month, minus mo ang 14. Ganun lang tayo ng ganun. And that's the reason why kung minsan, nabubuntis ang babae kasi nga mali ang calculation. Okay, that's one. Another is ovulation. Okay, normal ovulation alternates between the 2 ovaries. And the woman can feel this through a pain on the left or the right side of the lower abdomen. Mitral smirch ang tawag natin dyan. Okay? So that's one. Another is from the time of menarche up to the time of menopause. Remember, hindi ko sinasabi ang number. Ang sinasabi ko is description or the stage. From menarche to menopause, okay, then menstruation is expected. But ovulation may not be present in the early years of menarche and in the latter years of menopause. Clear? Okay. So yan ha. Now my dears, isa pa. The egg that is being ovulated by the woman is as old as herself. Very important. So if you are 15 at rineregla ka, yung itlog na lumalabas sa'yo kasing edad mo na 15 anyos. So that egg has been in that ovary for the past 15 years. Okay? That egg that is in the ovary has been there for the past 15 years. So if you're 40 and you are still ovulating, the egg that is released for the whole year would have been 40 years in your ovary. Clear nyo na? So ano ang significance niyan? Naku, the significance is, no, the older the woman gets, okay, the older the egg that is being released, and that's the reason why congenital anomalies are more common in the latter years of pregnancy ages. Clear? Kaya nga ang WHO nagbigay ng standard that the ideal reproductive age would be between 18 years old to 35 years old. Okay? So, below 18, we call it a teenage pregnancy, which we discussed yesterday. Above 35, ang tawag namin dyan sa clinical area is elderly gravida. As in fact, sa family planning, no, the nurses and midwives that would motivate women, okay, in our area would be asking this question: Mrs., tapos na ba ang number of children na gusto mo? Na-reach nyo na ba ang family size na gusto nyo? Basta na-reach ang age ng 35. The nurses will be asking, are you done with the number of kids that you would like? Or is the family size that you have now enough? Because if the woman says, yes, I am done, I would like to end my pregnancy process, then we recommend ligation. Clear? But before that, we do not. We would recommend temporary methods para anytime na gusto niyang mabuntis, pwede. Are we clear, ha? So yan. So that's the reason why habang tumatanda ang babae, mas at risk for congenital anomalies kasi nga nabubulok na po ang itlog. Ayan. So as a nurse, as a maternity nurse, what do I suggest? Kahit kayo, sa clients nyo, have your children between the best years of reproductive ages. And that will be 18 to 35 years old. Are we clear? Yung unang ding the first few years of pregnancy, I have noticed, no, among some primates, pag yan mga 30, I noticed kasi, we noticed bilang ako, it's been seen sa evidence-based practice that women now, we're talking of professional women like you, no, marry later than usual. Dati-dati may time pag 25 ka at wala ka pang wala ka pang boyfriend, old maid ka na. Pag 28 ka, ay naku, late nag-asawa. Aba ngayon, 34 na, hindi pa nagpapakasal, hindi pa nag-aasawa. 40 years old, saka mag-iisip mag-asawa. So women now are marrying later. And the significance there is, as soon as they get married, I hope they have a child immediately. Kasi pregnancy will be more difficult, ovulation will be more difficult, and pag yan nag-ovulate at naging buntis, baka the risk to anomalies may be there. Okay? So that's one in ovulation. Pangalawa sa menstruation, ang haba na ng sinabi ko ha, because of this. After this, I'll not anymore discuss. We will go directly to answers, no? So pangalawa sa menstruation, no? So menstruation begins at menarche. And that is usually on the average at 12 years. 12 years pa tayo. Although, my dears, in practice, marami na tayong mga 8 years old na rineregla. Okay? So, it persists, okay, until the woman is menopausal. So, menopause means permanent cessation. And usually, the beginning of menopause begins at 45 and ends at 55 years old. So it's a 10-year process ang menopause. Hindi po yan pag tumigil ang regla at 45 menopause ka na. Hindi po ganyan. It will begin at 45 by missing some cycles until you reach 55 when you miss the whole 12 cycles. Isang taon na wala kang regla. At the age of 50, 55, then you are finally menopausal. Ganon ha? So what is the significance of menstruation during the perimenopausal period from 45 to 55? The significance is baka ka mabuntis nang ayaw mo na. Clear? Ayaw mo nang mabuntis, ang kaso akala mo menopause ka, the age of 47, rinireglak pa, nabuntis ka. And so you become pregnant, and so you have an unwanted pregnancy. Kahapon ang sabi natin, the pregnancy should be planned and wanted. Okay? And so, as I said, pag 35 na yan and above at na-reach na ang family size na gusto, we recommend permanent method or tubal ligation. Still, katulad ng sinabi ko kahapon, hindi pa rin yan 100% no, na effective. May 99.5 o may 99% ka pa. Pag ikaw yung 1%, mabubuntis ka. So what am I saying? For as long as the woman is menstruating, kahit irregularly or regularly, the tendency to pregnancy is there. We're talking of generalities. Okay? Yan, ha? So that is menstruation. Then we go to menstruation, which is the cause of hormones. Menstruation, which is the cause of hormones, which is caused by hormones, sorry. And so, again, okay, menstruation is definitely, okay, interrelated by three organs. So the first one is the B or the brain, the second is the O or the ovary, and the third organ is the uterus. Kahapon na-mention ko ito. For purposes of mastery, please master. So the master organ is the pituitary gland. However, the first organ that will initiate menstruation will be structure. The first structure in the brain that will initiate menstruation will be your hypothalamus. So hypothalamus, yun ang unang-una. Now, the hypothalamus will release the gonadotrophic hormones. So the gonadotrophic hormones or the gonadotrophic releasing hormones. There are two. And alam mo ang maganda sa menstruation, sa hormones na to, they are orderly, sequential, in order. So the first gonadotrophic hormone will be your follicle-stimulating hormone. Anong gagawin ni follicle-stimulating hormone? It will act on the ovary. So it will act on the ovary. Ang trabaho ni follicle-stimulating hormone is to stimulate 1, 2, 3, 4 follicles in the ovary, whichever that is, either left or right. Remember that the girl is born with millions of follicles of eggs in her ovary. So, stimulate ng FSH ngayon yung ovary para mag-ripen. And one of these eggs will ripen. Yun ang magra-rupture. So, FSH stimulating the ovary to ripen in preparation for ovulation. At the same time na ini-stimulate ni FSH yung ovary, lumalabas ang first ovarian hormone in the form of estrogen. Okay? So lumalabas, no, ang first hormone ng ovary, which is estrogen. Estrogen, by the way, is the hormone that makes a woman a woman. Okay? Now, ang estrogen tumataas. Pag masyado nang mataas ang estrogen, it will suppress the FSH so that the LH will now be secreted. The LH will act on the ovary to rupture the ripened egg. And as it is acting, by the way, kasama na sa estrogen, nung lumalabas sa estrogen, meron na ring progesterone na konti na lumalabas kasi mag-partner. But the estrogen, of course, how do you call this, is higher, more. So, nung lumabas si LH, renapture niya yung right na egg, tapos nag-shine si progesterone. When progesterone, nag-shine si progesterone at na-rupture si egg, si estrogen bumaba. Pero mag-partner pa rin yan, meron pa rin. Then, of course, ovulation occurred. Okay? What did estrogen do to the breast muna? The breast. Anong ginawa ni estrogen? It stimulated the ducts of the breast. Stimulated para maging mature. Okay, what did the estrogen do to the uterus? It created an additional increase in the depthness and thickness of the endometrium. So we have what you call the proliferative phase. Clear? Now, after estrogen, okay, nariyan na, tumaas si progesterone. What did progesterone do? Acted on the previously acted structures of estrogen. So sa breast, dinevelop ni progesterone si acinine cells in preparation for lactation. And then sa uterus, okay, lalong kinapalan ni progesterone yung endometrium. So you have a secretory phase in the uterus. Okay? Now, this secretory phase, okay, is in preparation for a possible implantation if fertilization occurred. Clear? Ayan. Ha? Ngayon, 2 linggo na nag-antay. Nasa secretory phase na. Okay? 2 linggo yung secretory phase, yung makapal. Pero remember, okay, that the ovum lives only for 24 hours. So dapat ma-fertilize within 24 hours. If there were no sperms, by the time the ovum was released, and within 24 hours, the ovum dies. Okay? If there is a sperm, the ovum is fertilized, and the development of the ovum now, or fertilized egg, will ensue until it reaches the stage of the blastocyst, that will be the stage of the zygote to implant. Clear? And so, pag naka-implant na yan, okay, pregnancy begins. Oh, well, it has begun with fertilization. Pero pag naka-implant na yan, higher ang kanyang chance to progress. Kasi, let me see, a number of abortions can occur. No, abortion can occur from the time na na-fertilize an egg to prior to implantation. Maraming ganyan na cases. Blastocyst stage pa lang, nalaglag na. So, 6 weeks pa lang, positive na, buntis na, hindi natuloy kasi nalaglag. Anong nangyari? Was not able to implant, or in the process of implantation, nalaglag siya. Okay? May mga fertilized egg na ganyan. And so, abortion ensues. Are we clear, ha? Okay, let's go back. Walang fertilization. Walang meeting of the egg and the sperm. Okay? So, after 2 weeks, wala pa. Progesterone will now begin to be depleted. It will withdraw. Pag nag-withdraw si progesterone, susunod si estrogen. And with the withdrawal of hormones, okay, menstruation begins. Your endometrial cells, your endometrium, will begin to be shedded off in the form of your menstruation. So menstruation will include blood, mucus, endometrial cells, which are the solid particles, as well as the fertilized egg. Very we clear, ha? So, ayan. And so, let me just, tignan natin, ha? So, your menstrual cycle has several phases. Okay? So, you have your ovarian phase, and you have your uterine phase or cycle. Okay? Your ovarian cycle has two stages. Your follicular stage and your luteal stage. Your uterine cycle has three cycles or stages. Your proliferative stage, okay, and your secretory stage, and your menstrual stage. Okay? Sa follicular phase of the ovarian cycle, you have two hormones. No? You have the FSH and the estrogen. Sa luteal stage, you have the LH and the progesterone. Sa proliferative phase, you only have the estrogen. Sa secretory phase, you have the progesterone. So, ganun lang siya. Yan. Clear? Okay, so clear, ha? I went into specifics kasi marami akong feedback all the time from nursing and midwifery na nahihilo at nalilito sa hormones. Please don't be. And be simple lang. So in this question, sa number 5 pa lang tayo, ha? Okay? These are characteristics of a woman with normal, o sinabi na, normal, except which one? Encircle the word which one. Okay? So ano yon? Ha? Alin ang exception? Anong number? I would just like to see your answer sa number 5. Okay. Perfect. Na-waste yata yung aking pinagsasabi. Alam nyo lahat. Perfect kayo. Okay? So, characteristics, letter A, alternate is true. Letter B, she can more or less predict her next period. Yes. Kaya ang babaeng nagugulat na may regla siya at natagusan siya, ay tanga. Diyos ko. You should be aware of your fertility. You should be aware of your body. Ha? Hindi yung pagtingin mo, ay, mayroon pala ako. Gaga. Sus Mario. Naiinis ako sa mga babaeng ganyan. Kasi you know yourself. You know your calendars. No? Especially nurses. Sus Mario. Totoo yung mga ano nyo na yan. Tanga. Nasa klase, biglang gaganong. Tapos kakalabit sa katabi. Meron kang napkin. Ay sus, idadamay mo pa yung walang kamuang-muang sa regla mo. Okay? So, what am I saying? What am I saying? What I am saying is, you can predict your menstruation. It may not be on the exact day, but you know that your period is coming. Sasabihin nga ng iba, excuse ay, kaya mainit ang ulo ko kasi malapit na akong datnan. Yun, you can predict. So in other words, ang laki-laki ng bag mo, ha? Wag lang power bank, wag lang gadget, wag lang charger ang ilagay mo dyan. Maglagay ka rin ng napkin para hindi ka nagugulat. Para din yung there are also women, There are also women na tanga. Hindi pala alam, buntis na. Oh my goodness. There are women like that. In my encounter of billions of women, may mga women na hindi sukat akalain na buntis. Ang nagtanong pa yung asawa or your partner, sweetheart, buntis ka ba? So the babae said, bakit mo tinanong yan? Kasi 2 buwan nang hindi mo ginagamit yung napkin na binili ko sa supermarket na nasa pantry. Kasi yung lalaki pala ang nagro-grocery. Even mothers, meron akong isang alam na nurse yan, of course. She was monitoring secretly her daughter. May boyfriend Alam mong ginagawa ng nanay niya, sabi ko, gaga ka talaga. Totoo naman Kwento niya, she shared. Every daw, alam niya yung cycle ng anak niya. So every time na alam niya na darating na, she would inspect kasi siyang nagro-grocery kung nagagamit. There was a time, napansin niya 3 months na, 4 months na, hindi nagagamit yung kanyang binibiling napkin. So she confronted the girl. Hey, Kordapya, buntis ka ba? So the girl was surprised. Bakit mo alam, mami? Wala naman akong sinasabi. O di ayun, totoo, buntis nga. Clear? O sige ha. So let me go back. Predictable siya. If, by the way, may I just clarify this? If it is regular. Tama? Kaya lang ang nakalagay kasi doon sa question, normal. So we assume regular. And then it is expected that menstruation occurs from puberty. Mali na yon, ano? It should be menarche. 245. Mali na rin yung 45. It should be menopause. Kasi what happens after 45, 46, 47, 48? Pwede ka pang reglahin. So that should be from menarche to menopause. Yun ang mali. And then it can last from 2 to 7 days. Yes, it can. Okay? Okay. Okay. So, number 5 is letter C. I hope you don't mind ha. Paulit-ulit lang akong sinasabi ko. Alam kong master nyo na yung mga hormones na yan. Pero I would just like to be sure. Kasi these are the basic hormones. Alam mo, yan ang favorite. Ewan ko ba? Diyan sa mga examiners na yan, kung bakit favorite nila palagi, menstruation. Hormones, yung palagi. Kaya dapat you should be ready. Okay? Sige, now let's go. Number 6. O, eto na. Ha? Si number 6. What is your answer muna before I go into further assessment? What is your answer muna? Number 6. Okay. Very good. Mukhang hindi na natin kailangan i-discuss ito eh. So this is all about the passage, the pelvis. Do we still need to discuss? Kasi tama kayo. The answer, the most important and this is the most significant word, shortest. Diameter of the pelvis of the woman considered in assessment is, okay? The answer is letter C. Okay. The answer is letter C. Obstetrical conjugate. Okay. So let me go back. O sige, may nagsasabi dito, yes po. So in response to some, the passage, okay, there are 3, 1, 2, 3. There are 5 factors that affects labor. Okay? The 3 classic P's, power, passage, passengers. I-include natin ang psyche of the woman, mind over body, and then i-include natin ang position of the woman. Okay? Position in labor. So, 5 yan ha. Power, passage, passenger, psyche, and position of the woman in labor. These are the 5 factors that can make or unmake the labor process. Okay? Now, number 6 is all about the passage. There are 2 passages, no? 2 general passages in labor, okay, of the fetus in labor. The first will be the soft passages, and the second is a major hard passage. So, sa first passage, sa soft passages, you have the cervical canal na dadaanan ng bata at saka yung vaginal canal. 2 soft passages because they are made of tissues. They are made of muscles. Na pag makipot, pwedeng mapunit, or kung makipot, pwedeng makat in order to enlarge the opening so that the baby can pass through. Okay? However, the major passage, which is the hard passage, is the pelvis, which you cannot cut or it cannot be torn. So anong gagawin natin? Yung bata or tayo ang mag-a-adjust sa pelvis. We cannot touch the pelvis because it is the hard passage in labor. Now, when we look at the pelvis, let's go into the very basic. How many bones are there in the pelvis? 4. 4 na buto. 2 hip bones, 1 sacrum, at 1 coccyx. So there are 4. Okay? There are 4. 2 innominate bones, 1 sacrum, and 1 pelvis. Let's go into, 1 coccyx. The sacrum is the backbone of the pelvis where everything is attached. Yung part of your lumbar vertebra at saka part of the innominate bone naka-attach sa pelvis. Ay, sa sacrum, sorry. And then, naka-attach sa sacrum is the coccyx. Ang tawag lang yan, one standard statement is that it is the only bone that moves, the movable bone of the pelvis. Then we go into the hip bone or the innominate bones. Sa innominate bones, you have 3 parts. The biggest, yung sinusumba at kinekendeng ng babae, is what you call your ilium. The second part, which is the lowermost part of the pelvis, is the ischium. And the front part of the pelvis is the pubis. So when the left innominate joins the right innominate bone, okay, at the front, okay, so the left pubis and the right pubis will join to form the symphysis pubis. Are we clear? Clear na tayo, ha? Okay. Now, what is important here? So we talked about the structure. We talked about the structure of the pelvis. Please take note that you have a false pelvis, which is above the pelvic part, and the true pelvis, which is below the inlet. Okay? There are 3 cavities of the pelvis: the inlet, the mid-pelvis, which is important, and the outlet. So, dun dadaan ang baby. Okay? Please take note. Eto na, pupunta na ako sa significance. Remember that we are always going to what? Assess the pelvis in relation to the pelvic head. In relation to the head of the baby. Ano ba itong pinagsasasabi ko? Nagugutom na yan pa ako. Okay? So, eto siya. This is your standard. The fetal head versus the pelvis. Parehong matigas. Ang fetal head matigas. In fact, that is the most difficult part of the fetus to deliver, and it is the biggest part. It is 1/4 of the total length of the fetus. Pag nakalabas ang ulo, huminga ka na ng malalim, 90% okay na. Kaya lang, may babantayan ka pa. Ano yun? Shoulder naman. But that is only 10%. 90% of the time, pag nakalabas ang ulo, okay, sa pelvic canal, we are safer. And so, because the pelvis is an inanimate being, wala siya, no? Hindi yan ang mag-a-adjust. It will be the fetal head that will adjust to fit the pelvis. Kasi yung fetal head may utak. Remember kahapon I told you, it is the fetus that will expel himself. Matalino ang fetus eh. Naghahanap yan ng pinakamaluwag na area sa pelvis para lumusot through the mechanism of labor, through the cardinal movements. Napakatalino ng baby. Kaya niyang mag-navigate doon sa pelvis, looking for the biggest diameter. Kaya lang, ito na yung isa kong statement na pahabol. Bakit ba? Pag lumabas na yung mga ibang babies, nabobo na. Okay? So, ang aking ano dun is, baka naman na brain damage sa paglabas. Okay? Okay, that's just one lighter moments, no? Mayroong mga bata nung pinanganak na bobo. And so, here comes now, as I remember one consultant na inasisan ko sa CS. Okay? So sabi ko, Doctor, we have another cesarean. Okay lang na cesarean. Tapos sinabi niya, alam mo ba, sabi niya, na based on some readings, journal readings that I read, na mas matalino daw ang baby pag cesarean kesa sa normal birth. Sabi ko, ha? Sabi ko, bakit naman doktor? Kasi nga, hindi yan nabangga-bangga. Yung utak niya, hindi nabugbog-bugbog. In cesarean, Intact na intact ang bata. Ganon. At anyway, that was his statement. Well, possibly. And so we go back to the fetal head. What will the fetus do in order to fit, no? To fit the hard pelvis? Dalawa ang pwede niyang gawin. Number one, which is most important, flexion. Magko-complete flexion yung ulo. And pangalawa, molding. Magmo-mold, magdidikit ang kanyang parietal bones para lumiit ang space doon sa fetal head. So with that, it will assume the smallest diameter, and so hopefully it can fit the pelvic canal. Okay? So sa pelvis, our minimum na ako ha. Okay. Our minimum pelvic size is 10 cm. And this can be found sa obstetrical conjugate, which is letter C. At may isa pa na dadaanan ng baby that you should be quite be alerted of, and that is your bispinous diameter. So what diameters are supposed to be the smallest diameter in the pelvis where that can create a problem for the fetus? Yung OB conjugate, that is 10 cm, and the bispinous diameter, which is 10 cm as well. Now, ano yung bispinous diameter? That is the transverse diameter of the mid-pelvis, yung distance ng dalawang ischial spines, where we determine station. Okay? So this should be 10 cm para adequate ang baby. Tapos yung OB conjugate should be 10 cm. And of course, the rest of the diameters should retain its standard size. Sa inlet, okay, you have 3 diameters there. Yung AB diameter. The first diameter, which is clinically significant, is what we can measure, and that is the diagonal conjugate. And what is the measurement of the diagonal conjugate? It is 11.5. Yun ang minimum. In some books, if you read some books, may 12, may 12.5. Wala na ako doon. Ang importante, yung minimum, so that alam mo kung papasok yung size doon sa minimum na diameter. So, 11.5 ang diagonal conjugate, 10 cm ang obstetrical, and you have the anatomical, which is 11 cm. The bispinous diameter is 10 cm. Okay? And then you have the outlet diameter, which should be 11 cm or more. Yung outlet diameter, we are not very worried because kung mabaraman sa outlet, we can use a forceps in order to deliver that fetal head. And please take note, that having given you the minimum diameter, size ng pelvis, the minimum acceptable or the normal diameter of the fetal head should also be 9.5. Clear? 9.5 ha, dapat ang size ng head. And the fetal diameter that can present a 9.5 measurement is the SOB and the SMB. What is SOB? Okay. Suboccipito-bregmatic diameter. What is SMB? Submento-bregmatic diameter. Pareho itong 9.5. Now, the SOB is a completely flexed head. This is your vertex or your occipital presentation. Okay? And the SMB is a fully extended head attitude. And this is your face presentation. Are we clear? So, vaginally, lalabas ang vertex presentation lalabas ang face presentation. Are we clear? Okay. So yun lang ha. So tinitingnan natin ang ulo versus the pelvis. So in number 6, letter A, letter B, okay, the distance between the two ischial spines is known as the bispinous diameter. But the best answer is letter C kasi ito yung una ninyong mame-measure OB conjugate because this is in the inlet of the pelvis. Yung letter B, this is in the mid-pelvis. Diagonal conjugate is clinically the most significant. So knowing this, you know very well that normally the diagonal conjugate is 1.5 bigger than the OB conjugate. And that you can measure through internal examination. Okay? Okay? Okay. So number 7. Now we go to the concept of fetal circulation. This very important, I mean very, very simple lang ito. So the word temporary, okay? And then it does not na naman, does not. Okay, so you know very well sa fetal circulation, this comes in the first trimester. Please take note, in the first trimester, you have organogenesis. What do you mean by organogenesis? All organs develop, okay, or all systems in the fetus are begin to be in place in the first trimester. In the second trimester, the fetus begins to gain weight rapidly to reach term. Now, in the third trimester, the fetus will now try to mature rapidly as well, particularly the lungs. And so fetal circulation, which begins to function in the first trimester, has what? Several characteristics. And what is that? Number 1, the veins carry the oxygen and the arteries carry your waste products or your carbon dioxide. So opposite siya ng adult circulation. So that's one characteristic. Okay? The second characteristic is that the oxygen passes from the placenta to the fetus via the cord. Okay? So yun ang ating it passes from the placenta to the fetus via the cord. So ang pagkain, ang blood nang gagaling sa placenta papunta sa cord. Cord sa baby through the cord. Yung pagkain, blood and everything comes of course from the mother. Now, that being said, the cord connecting the placenta to the fetus, you know that the cord has 3 important blood vessels, and this is your AVA, 2 arteries and 1 vein. Okay? So the vein is found at the middle no, of your 2 arteries. Pwede kang mawalan ng isang artery, either left or right, buhay pa ang baby. Pero hindi ka pwedeng mawalan ng vein. The minute the vein disappears or there is no vein, the baby dies. Walang baby, patay yan. Kasi there will be no passage for the nourishment and everything. Okay? Now, so that's another characteristic, ha? Okay. Now, the third characteristic sa fetal circulation is that there are temporary structures that facilitate the exchange of gases and nourishment. Okay? And these ones should close at birth. That is a characteristic. Pag hindi nag-close at birth yan, then you develop a congenital anomaly. And generally, this is a heart disease. Okay? So, lahat yan mag-close at birth. No? What closes these structures? There were some theories na it is the mechanism of labor, it is the pressure of the contracting uterus, it is the pressure of the amniotic fluid that pushes all these structures to close. Okay? So ayan ang ating concept. And so therefore, ang tawag nito, your temporary structures are 3. Diba? Si ductus venosus, si foramen ovale, at saka si ductus arteriosus. Now, going back to the artery, if there is one artery na wala, reportable kaagad ito sa pediatrician because the pediatrician will now, or the obstetrician or the doctor, will now begin to completely assess the baby for the possibility of a congenital anomaly. So yun. Okay? So among these three, foramen ovale between the two atria, okay, ductus venosus, okay, from the placental vein, umbilical vein to your inferior vena cava by passing your portal circulation, and ductus arteriosus, of course, from your pulmonary artery, diretso tayo sa aorta by passing the lungs. So, walang function ang lungs ng fetus in pregnancy. The lungs will only begin to function after birth or at birth when the baby begins to cry. Kaya nga, very important that you listen to the first cry of the baby. Kaya kailangan ang nurse, magaling ang kanyang tenga. Okay? Listening to the first cry. Because the first cry will tell you that the baby has started to breathe. That the lungs have started to function. Okay? So clear tayo. Yan, no? So let's go back. Your answer here, of course, is letter C. Ductus arteriosus. Ito talaga ang pinakamahirap magsara sa tatlo. And so if it does not close, we have what you call a patent ductus arteriosus that needs to be operated on depending upon the pediatric surgeon's assessment as to when is the best time to do this. Now, usually after birth, when you auscultate, no, on the baby's lungs, meron kang maririnig na mga you will hear the fact that the arteriosus has not yet closed. Okay? So meron ka pang naririnig na tunog. Meron ka pa. But then there are many babies na as they progress and grow from 1 week to 2 weeks to up to the infant period, this arteriosus will slowly close. May mga ganun, natural, no? So you just wait. Kaya hindi agad-agad yan, no? So during infancy, i-assess pa rin kung meron pa and may murmurs na sinasabi until talagang ma-determine nila kung meron ang PDA or wala. And so some doctors will give the drug endomethacin in order to close the ductus arteriosus. Okay? So that is our concept for number 7, fetal circulation. So number 8, again, ito na tayo. This is part of the menstrual concept that we took up earlier. Underline the word sequence. Pag sinabing sequence, order, progress. Hindi pwedeng bara-bara. So kung number 1 siya, number 1 talaga. Number 1, number 2, number 3. In that order, ha? In that order. Okay? Hindi pwede yung 3 na mag-number 1, 2 na mag-number 3. Okay, so in which sequence would the structures and organs work to effect menstruation? So we have taken this up. We said from the brain to the ovaries to the uterus. So una muna si brain, gitna si ovary, last si uterus. So if you look at this, no? Okay? Ang pwede lang mag-qualify. So letter B can qualify, letter A can qualify. Letter C is automatically wrong kasi it begins with the ovary. So mali na yan. However, letter D is your most complete answer. So your answer is letter D. From the hypothalamus that will give you your gonadotrophic hormones to the anterior pituitary gland that will give you your sa hypothalamus, gonadotrophic releasing hormone, to the pituitary gland that will give you your FSH, LH, to the ovary that will give you your estrogen, progesterone, and to the uterus that will give you your menstrual flow. Okay? So that will give you your menstrual flow. So number 8 is letter dog. Okay. So we go to number 9. Again, hormone. A major hormone of the woman that is responsible mainly for the development of breast ducts. Nasabi ko na ito. So underline the word breast ducts and initiates the release of LH when it decreases in the blood. So your answer will be letter boy. The word breast ducts alone is already letter boy, estrogen. Your progesterone will go to acinal cells, Your prolactin is a breast hormone coming from the anterior pituitary gland. Okay. Number 10, we go into physiologic maternal changes in the woman. Okay. So in pregnancy, there are several changes that are physiologic, brought about by the hormones from the placenta as well as the hormones from the mother. Okay. And among these, the most striking and the most significant, the most striking and the most significant change is found in the circulatory system as well as in the cardiac system. Okay? So, when the woman is pregnant, what happens, What happens to the blood volume? It expands by 40 to 50%. It expands by 40 to 50%. So, expanded blood volume because of the demands of the fetus. Ano ang effect sa nanay? The woman becomes anemic. So, anemia is, tawag nito, expected. We have such a thing as a physiologic anemia in pregnancy. Anong ibig sabihin ng physiologic anemia? I discussed this kahapon, I believe. Bumabagsak talaga ang hemoglobin level, okay, in pregnancy because of your expanded blood volume. So if the hemoglobin level is 12, which is the minimum normal standard, pag nabuntis kayo, I will not be surprised if your hemoglobin drops to 11 grams. Okay? Now, if the Filipino woman, sinabi ko na naman to sa inyo kahapon, has an average of 11 grams, Okay? Per DL, okay? Then pag buntis siya, babagsak yan sa 10, more or less. Now, among the women na nasa laylayan of the society, okay, since they are not fully nourished, they have no proper diet, then sometimes their hemoglobin is 8 or 9. Pag sila'y nabuntis, babagsak pa yan. And so they become moderately anemic or even severely anemic. Okay? So what do? Automatic, we give iron as a supplement, as a supplement in our prenatal care. Kahapon, I also said something about this. Pag rineregla ang babae, the gynecologists, the women's health doctors would definitely recommend that you take iron supplementation to assist you in your menstruation. Lalo na pag malakas kayo at medyo matagal kayong reglahin. What do I mean by matagal reglahin? Kung inaabot kayo ng 1 week. Kasi our usual regla is 3 to 5, di ba? Pero hanggang 1 week lang kayo, 7 days. Ako, magpapatawad ako up to 10 days. Medyo na yon, hindi na tama yon. But more than that is not already menstruation. You are bleeding. I emphasized that yesterday. Okay? So we have a physiologic anemia that can occur, but this can be corrected, of course, by our iron supplementation in pregnancy. Then we have increased clotting factors. Nag-i-increase yan as part of its physiologic adaptation. Your prothrombin level, your fibrinogen increases. Clotting factors 7, 9, and 10 also increase. Okay? The effects of hormones, because of the high effects of estrogen and progesterone, may effect din sa nanay. And what is that? Moodiness, weepiness, anxiety, ambivalence, lahat ng yan. Okay, these are all psychological. And then this can be brought about by hormonal factors. Parang kayo, hindi nga kayo buntis, but you have regular menstruation, etc. So you experience the moodiness as well. Mainitin ang ulo, no? Malungkutin, okay? Nadidepress. Pero be careful sa depression, ha, baka ibang usapan na ito. Okay? And then of course, ang tawag this, encouraging rest in between periods during the day is definitely encouraged. But because our question is a maternal chains, tatlo lang ang maternal chains dito, A, B, and C, and your answer is letter boy. Okay, increased clotting factors, thrombus formation. So what do we ask our normal pregnant women to do? That they should be active, that they should consider pregnancy as normal and physiological. So dapat walang masyadong nag-iiba. So pwede pa rin pumasok, pwede pa rin gumawa ng household chores, etc. Unless may signs of abnormalities like spotting or cramping or something else. Okay? Of course, we allow rest periods, but not all the time. Okay? So yan ang ating concept sa number 10. Now, number 11. Oh, by the way, no? Naka 1 to 10 na tayo. I would just like to know, narito na ba si Feds? O si Ian? Wala si Ian?
Good morning, Ma.
Oh, yan. Ayan, si Feds. Nakita na kita. Can you ask kung out of the 10 questions, how many got perfect?
Okay po. So, RNs, pasagot na lang po sa chat box natin. Thank you. Ayan. So, sa chat box, Ma, meron pong 9 out of 10, 7.
Uy, kumukulot ka, Feds.
Ayan po. May nakakuha po ng 10, Ma'am.
Good. Very good.
Hello, Ma'am?
Yeah, good.
Yes po, 10.
Very good, very good. Anong lowest po so far?
6 po, Ma'am, yung nakita ko po.
Okay, 6. Okay. So yung 6, please identify your weaknesses, saan ka nagkamali, no? Although 6 is not bad, pero that can be improved, no? Yung 10, continue to do so. Okay? So let's go to number 11. So what is our concept in number 11? Significance of 24 weeks gestation. So here comes now the mother attending a mother's class at the prenatal clinic. So she answers a question regarding the significance. The nurse answers the question. Ano kayang significance pag 24 weeks AOG na yan? So 24 weeks, if you're going to convert that into months, that will be 6 months, no? 6 months pregnant. And the answer of the nurse is very crucial. So by 24 weeks, which among these would be the best answer? Asan na sila? Okay, so your best answer, of course, is letter D. Letter D. Because the fetus has passed the critical, tawag nito, critical age of viability, which is 20 weeks. No? So letter A, most sensitive to teratogens. By this time, ang pinaka-sensitive to teratogens would be your first trimester when there is organogenesis. Okay? When there is organogenesis, sensitive siya sa teratogens that can cause abnormalities. Although, throughout pregnancy, there will always be some risk. Particularly, I read somewhere that particularly neurological or brain, meron pa rin risk up until term. Okay? Now, but yung mga structural defects, etc., is generally on the first trimester. Lung maturity is complete at 24 weeks. No, it is just beginning. Remember, by 24 to 26 weeks, surfactant begins to develop, and it is the surfactant that finally seals off the maturity of the lungs by seeing to it that it is adequate. Okay? So yan, ha? And then the fetus weighs 2.5 pounds and is about 14 inches na not very significant. Okay? So 11 is letter dog. Now let's go to number 12. Number 12. What change in the urinary system predisposes a pregnant woman to urinary tract infection? Ang pregnancy is definitely at risk for UTI, more at risk than the normal woman. Okay? Why? Why? Can I see some answers, please? Tingnan ko lang. Ano, wala. Answer, please. Okay, so I see a B. I see a C. Okay. Okay. Sige. So let's go to the correct answer. Decreased bladder capacity for UTI? Well, no. Kasi nga ang UTI, remember, it attracts organisms as the urine stays there and as the urine increases. No? Increased blood volume is not. The effect of increased blood volume is more on the blood hemoglobin decrease. Letter C, decrease pressure on the bladder by an enlarging uterus. Pwede ito kung first or last trimester, but walang sinabi ito sa question. So the answer must be letter D. Stasis of the urine in the bladder and ureter due to hormone. What hormone is that? Progesterone. So your answer, the best answer is letter D. Yung letter C, pwede siya kung nasa first or last trimester. Okay? Pero walang sinabi sa question. Therefore, the best answer is still letter D. Please remember, among all hormones produced by the woman in pregnancy and by the placenta, okay, progesterone is one of the two hormones that relaxes structures and organs. So, progesterone relaxes the uterus. Therefore, it balances the contracting effect of estrogen. Magpartner yan eh. Balance yan. So, progesterone relaxes, estrogen contracts. Other hormones that contract definitely will be your oxytocin from your posterior pituitary gland and your prostaglandins from structures, from the decidua, okay, prostaglandins, and from the seminal fluid, from the semen, from the endometrial cells. Pag nag-release ng prostaglandin, contraction yan. Yan, estrogen na yan, contracting. But with the presence of progesterone, nababalance yan, relax. Okay, so walang nangyayari. So what happens if progesterone is decreased? No? So therefore, sandali lang, before I go down, progesterone relaxes your ureter. It relaxes your bladder. And so prone ka sa stasis. And if the urine stays there for some period, it can attract the organisms that can become infections. So, mas prone ang buntis sa UTI and than the non-pregnant. And of course, if the woman is diabetic, talagang prone siya sa UTI. Okay? Now, going back to what I said earlier, so if the progesterone decreases, so pag bumaba si progesterone ng konti and estrogen persists, the woman might feel contractions. Or pag nag-contract na yan, the blood begins to be expelled. So pwede kang magkaroon ng either preterm or abortion. Or pag term ka na, labor can begin. Remember the theory of progesterone withdrawal theory. Nauunang bumabagsak si progesterone, continuous pa si estrogen. Pag naiwan si estrogen, lalabas si prostaglandin, babagsak si oxytocin. All of this will start contracting the uterus and the cervix begins to dilate. So labor begins. So yan tayo, ha? Okay, number 13. What assessment data would the nurse expect to obtain from a woman who is 14 weeks pregnant? Again, when you see numbers like 14 weeks, encircle nyo kaagad yan kasi significant yan sa answer. So 14 weeks is more than 1 month more than the first trimester. Okay? So A, B, C, and dog. Ano sa tingin nyo ang sagot? So I am reading an A. I am reading an A. I am reading a B. I'm reading an A and B ang naririnig ko. So tama kayo, we are after heart rate. Okay? So that can either be A or B. So the uterus is just below the navel. Okay, is definitely not the answer. You know very well that at 14 weeks, no, the uterus is just 2 fingers above the symphysis pubis. Okay, so hindi yan. Fetal movements are reported by the mother is not definitely true. Fetal movement will come in once the fetus is viable. So let's go to A and B. Counting the heart rate with a fetoscope and auscultation of the heart rate with a Doppler. So the better answer, where can you get the heart rate better? Can you get it more sa fetoscope or can you get it sa Doppler? The best answer is boy. At this point, your best gadget is a Doppler. By 10 to 12 weeks, Dopplers can now be able to determine the heart rate. Ang fetoscope is just like a stethoscope, my dears. So you can do this on the latter part or on the middle part of pregnancy, which is above 20 weeks. So the answer is letter boy. Okay? So ayan ha, we're looking at the fetal heart rate. Please remember that fetal health assessment is as important as maternal health assessment. Okay? Next, we go to number 14. We now do the IE as a competency. So what are the purposes of internal examination? So first, to determine that the bag is intact? Yes. Although tayo as nurses, ang unang-una nating ina-assess is the cervical dilatation. So remember, nga pala, in IE, here are your policies and standards. Number 1, for the nurse and the midwife, we can only do IE in normal labor. We cannot do an IE in abnormal labor. Okay? Number 2, since we can only do IE in normal labor, we cannot do IE in pregnancy. kahit normal yan. Clear? We cannot do an IE in pregnancy. Okay? Now, another is we can only do IE in normal labor basta walang previous bleeding tendency. Walang previous bleeding history. Clear? So before you do the IE, nagtanong, Mrs., dinugo ka ba bago ka nag-labor? That is a basic question. And the last is, you can only do IE if and when you are fully certified to do so by a certificate of competence. So yon ha. So hindi ka pwedeng mag-IE sa non-pregnant sa non-pregnant. Sa gynae, hindi ka pwedeng mag-IE. You can only inspect. You can only inspect the vaginal canal. Like what I said kahapon, you can put your 2 fingers down, ibaba mo lang and tingnan mo lang yung periphery. But you cannot insert the 2 fingers. Diyan ka lang sa baba. Diyan ka lang sa labia majora. Ino-open mo na ganyan to inspect the minora. Diyan ka lang sa baba. Ipasok mo ng konti, ibaba mo ng konti to check your perineal area, to check your vaginal canal. But you cannot insert your 2 fingers inside the vagina. Okay? So, why do we need to do the IE in labor? Primarily to detect cervical dilatation. In order to assess cervical dilatation. Wala naman dito. Okay? Kasi assume na yun. Next that you can do is you can determine. Okay? You can determine the presence or absence of the bag of waters. Kaya kahapon sa partograph, remember, M, B, C, I, A. M meconium, B blood stain, C for clear, I for intact, and A for absence. So you are determining, okay, whether that bag is still intact, and if it is not intact, determining, okay, the presence or absence of amniotic fluid and the color of the amniotic fluid. So pwede yan. Number 3, determining the station. Yes, this is one of the higher level of learning or competence. No? So when you do an IE, after you have assessed, no, you do an IE, you now try to locate, okay, where the ischial spine is. It can either be on the left or on the right side. So ipapasok mo ng konti, you ask the woman to breathe, okay, and relax. Mrs., ito nga sinasabi namin ay, Mrs. nga. Okay, as we enter para hindi masakit and there is no resistance, there's no rigidity of muscles, no? So once in-insert mo yan, you try to feel for an ischial spine. Ako noon, I would just try to feel for one ischial. Hindi ko na i-determine yung another one, no? And then once I check na meron ng isa, I try to see kung nasaan ang ulo. So I'm checking for station. And then, okay, I'm checking for station. And so IE is also done to check the degree of descent of the fetus. Okay? And then, what else? If I can go further, I will now try to check the distance between the 2 spines. Pero usually, kung nariyan na ang ulo, generally naman adequate na yung distance between the 2 spines. And so, your answer, number 4, to age the pregnancy and by estimating the size of the fetal head is definitely not the answer. You cannot age the pregnancy through IE. So your answer is 1, 2, and 3, and that should be letter A. That should be letter A. Okay? Ayan. Number 15. A nurse assesses the pregnant mother for signs of preeclampsia. And this would be her expected complaints. So, ano ang inyong signs of preeclampsia, no? Ano ang inyong sagot? I would like to see your answers sa chat box. Preeclampsia, underline the word preeclampsia. So I see a C. Okay, I see a C. Okay, so there's no problem. Your answer is correct. Flashing lights, spots before the eyes, and continuous headache. In fact, these signs that you see is already a sign of severe preeclampsia. So letter A, vaginal bleeding with discomfort. At this point, there is no spotting in preeclampsia in the beginning, but there is a blood disorder of severe preeclampsia. Okay. Now, persistent severe abdominal pain may not be characteristic of preeclampsia alone. You can have abdominal pain severely in ectopic pregnancy. Okay, so letter D, edema of the feet and legs that occur in the afternoon can be physiologic edema na at the by the time the day ends because of your walking and standing and your immobility na nakatayo, etc., pwede kang magkaroon ng edema. Even as nurses develop this when we generally do not sit down throughout our 8-hour duty. And so I remember one of our clinical instructor before na advising us that when we get to the dorm, pagdating namin sa dormitory, we have to face the wall of the bed or the higher part of the bed and put our legs up for 15 minutes para lang daw mag-drain yung fluid na nag-accumulate in our legs and feet during the day. So your answer is letter C. Okay? Now, talking about that, let me talk further about hypertension of pregnancy. So kahapon, I flashed on the slide the causes of death or mortality, morbidity of our mothers in the Philippine setting. So, na almost very insignificant ang difference ng severe bleeding, at saka ng pre-existing disease prior to pregnancy. So 28% yung kahapon. And then followed by hypertension in pregnancy. Okay, which we call either gestational hypertension, preeclampsia mild, or preeclampsia severe. So in gestational hypertension, you have hypertension and you have edema, but there is no proteinuria. So we call it hypertension, gestational. But in preeclampsia, the characteristic of preeclampsia over the rest is that it has hypertension, it has generalized edema, okay, and it has proteinuria. The presence of protein makes it preeclampsia. And that will be more or less ang problema natin dyan is prevent it from going into a severe form. Okay? And then you have the eclampsia. So anong karakteristik ng eclampsia? Pag nag-seizure lang ang nanay. Basta nag-seizure ang nanay at hypertensive, automatic eclampsia siya. Okay? And so sa preeclampsia, I will go traditional. Ang cut-off level is 140/90 and a proteinuria of +1 to +2. Pag yan nag-above 100 na ang diastolic, we consider it severe preeclampsia. Okay? And so what are the side effects of preeclampsia? Naku, encompassing ang preeclampsia sa pregnancy. If it becomes severe, it affects the brain. Ano ang effect niya sa brain? Stroke. It affects the eyes. What is the effect on the eyes? Blindness. But the blindness is reversible. After pregnancy, sa postpartum, bumabalik ang sight ng nanay by around 1-2 months. Okay? And then it can also affect the heart. We have congestive heart failure. It can affect the liver, ruptured liver capsule. It can affect the placenta. It can cause a small placenta, and a small placenta causes a small baby. By the way, the size of the baby depends upon the size of the placenta. If the placenta is malaki, then you have a macrosomic baby. If the placenta is maliit, then you have a small or gestational age baby. And this is what happens in preeclampsia. Okay? So it affects the placenta. It affects the kidneys. You can have a renal failure. It affects the blood. Pwede kang mag-thrombus formation that can eventually be detached as an embolus, and the embolus will really go into its favorite place, which is the lungs, and you have a pulmonary embolism that can kill the mother. Another effect on the lungs will be pulmonary edema. Okay? Preeclampsia severe can also cause one very specific blood disorder, and that is your HELP syndrome. Hemolysis, elevated liver enzymes, low platelet count. That is specific to preeclampsia severe or eclampsia. Clear? Now, may I just say this? Preeclampsia does not occur prior to viability. Preeclampsia occurs after the fetus is viable. And so, many believe, a lot of write-ups have come up stating that the main cause of preeclampsia is the fetus because you are pregnant. And so, when the mother goes into convulsive seizures, the only remedy for the seizures to stop is not anymore magsulfate. Magsulfate can prevent seizures, but it is difficult to stop seizures with magsulfate alone. So alam nyo, basta nag-eclampsia, we automatically check the status of the heart rate and we go to the OR to extract the fetus in order to save the mother and the fetus as well. So we do an emergency cesarean section in eclampsia. Okay? And so with that, Feds, can we take a break please? Ha? Kakain muna ako, gutom na, my dear.
Sure, ma'am. Sige po.
Okay, thank you so much. I'll be back in 20 minutes. Okay.
Noted po. Thank you po.
Okay. Okay, hello. Okay, so I'm back. So let's continue. So we were talking about preeclampsia earlier on, and I said something like preeclampsia does not appear before the fetus is viable. So any hypertension before the age of viability can be considered as a chronic hypertensive disorder. So possibly the woman has been hypertensive prior to pregnancy, but that is one of the risk factors that can lead to preeclampsia of pregnancy. Okay, so again, sa yesterday's discussion, so we have pre-existing medical conditions with severe bleeding. Next will be preeclampsia, which is more common in pregnancy, but they do occur in labor, delivery, and even postpartum. I had 2 patients that developed eclampsia during the postpartum period. There were no signs of actual preeclampsia until after she delivered. Okay, and I also had a patient twice again that died or expired in the labor room while I was monitoring her her hypertension. I was titering the mag sulfate in the Soluset when suddenly she just had rolling of the eyes and then expired. And so twice because of that, the doctor had to do an emergency post-mortem cesarean section. And we were able to save the baby because the baby was extracted 5 minutes after the CS was done or after the incision was done. Okay, so preeclampsia is definitely a major disease in pregnancy. Now, up to now, in the developing and low developed areas, it is not curtailed or even decreased. Why? Because the mother needs a regular prenatal checkup in order to more or less address preeclamptic signs and symptoms. Okay, so I can see here some notes in your chat box stating about blood pressures, which are 140/90, cha 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 cha. Now during my time, early in my practice or during my time, the highest that I would see then as hypertension was 190 lang over 110. Aba ngayon hindi na. We have cases of 220 over 120. Seemingly, hypertension has become millennial as well, no? So sumusunod siya. At saka remember, global warming tayo, no? So siguro, sumusunod din siya sa panahon, sa climate change, at saka sa generation. So now there are, especially among primates, preeclampsia is very, very affiliated with the primigravida, the young primigravida, who are the teenagers. So, isa yan sa mga what you call this, risk factors nila. So, preeclampsia is common at the extremes of pregnancy. Teenage pregnancy as well as elderly pregnancies. Okay? So, we watch out for that. Sige. So, next we go to number, anong number na tayo? We want to number 16. Upon history, the mother tells the nurse that she has hypothyroidism or a thyroid problem. The nurse knows that this existing medical condition can lead to primarily, it is an effect on the fetus rather than on the mother. And so letter boy is the answer, no? Increased incidence of abortion for those for the baby and congenital anomalies in the fetus. And so yesterday I said something like we give iodine for the mother and folic acid as well, no, in pregnancy in order to avoid congenital anomalies in the fetus. Okay? Now, increased risk for operative delivery, not necessarily. alam mo, as much as possible, this I would like to emphasize because this was asked, no, by a midwifery graduate reviewing, no? So, automatic kayo kasi, pag may abnormality na, no, automatic you think of a cesarean delivery as the best answer, which is not so. As much as possible, my dear nurses, we defer from doing a cesarean because it is more risky for both the mother and the baby. So, as much as possible, hindi kami nag-aano ng cesarean unless indicated. And there are two indications. The major indication for cesarean section is always a cephalopelvic disproportion, or what we call this, a problem in the pelvis of the mother that cannot really deliver the baby vaginally. So yun ang number one na factor. Okay? Now, the second factor, which is very important to us, is fetal distress. Now, remember what I just said earlier about eclampsia, that we had to extract the baby within 5 to 7 minutes, no? So that the oxygen of supply of the baby will not cause asphyxia. So that is another point to consider. So yun lang, dalawang yun, as much as possible, no? So on the mother will be CPD and on the baby will be fetal distress. Bago, yan ang aming true indications of cesarean. The rest, ganun na yan. What do I mean by that? Either the doctor would recommend or the mother insist on having a cesarean. Especially, no, kung ilaligate na siya throughout. Okay? O, sige. So yan ang ating concept sa number 16. Number 17, which is statement by the woman would show. Oh, by the way, meron ako ditong ano, no? There is an question here. Okay, this is an old concern. Saan mo ba talaga ilalagay ang preeclamptic mother? Near the station or far from the station? Okay, ang sabi nila, if tama kayo, if near the station, madaming distractions, the center of activity in a clinical setting is always the nurse's station, because that is where the charts are there, that is where the doctors would record, that is where the nurses would answer telephone calls, etc. So hindi siya ideal. Okay, but an old school of thought also insists that it should be in an area where it is quiet, dim, and less noise. Okay, less noise. Now, the reason why we put the woman, no, any woman at all, not only preeclampsia, but any woman with potential risk for abnormalities, is always a space. We provide a space, okay, for observation. So meron kaming first 10 beds doon sa area for observation. But still, the better answer here will be a quiet, dim environment that will prevent seizure. Okay? The nurse can always go to that observation area where we place our pre-eclamptic or eclamptic mothers. So we would choose the safety of the mother from eclampsia rather than tawag nito, yung monitoring, kaya namang yung nurse mismo or a nursing attendant or a student can just stay in that area in order to monitor the mother. Okay? So yun siya. Okay. So we go to number 17. Underline the word further teaching. That means iba ang sinasabi ng nanay, mali siya, so you need to correct. Kasi she needs further teaching. So you are looking for the false statement. Letter A, the egg lives a lot shorter than sperms is true. So 24 hours ang itlog, 48 to 72 hours ang sperm. Okay? There will be a slight increase in temperature before ovulation up to menstrual flow. Ito yung mali. Underline the word before and your correct answer should be after ovulation. So remember the diagram, ganyan siya, mababa, tapos tataas ng konti, then slightly decline, and then slightly go. So 36.4, for example, pre-ovulation to 36.7 post-ovulation. Okay? So ovulation happens 14 days before my next period is definitely true. And wet, clean cervical secretions show that I am fertile. True. Now, this is one of the most significant self-awareness for fertility. The minute the woman becomes wet, okay, or the minute the vagina becomes more wet because of cervical secretions, then we know that estrogen is definitely acting on it and that ovulation is about to ensue, if not nag-o-ovulate siya. Okay? So if you want a baby, avoid coitus. If you want a baby, do your assignment of sexual intercourse. Kung hindi naman, avoid coitus. And that's the reason why kahapon I was telling you about double methods. Remember, even if you have a method, the possibility of getting pregnant is still there. Nil possibility. So if you really don't want to get pregnant, you want to seal off any possibility of getting pregnant. And so what do we say? If you are using an artificial method, be mindful of yourself as well for signs of fertility. And we are recommending the refrain. No? We are recommending the couple to refrain from intercourse during the time that she feels the woman is fertile, aside from using a method. Kung yun ang ginagawa nyo, garantisado talaga na walang pregnancy. Okay? So, methods will just be there to provide you protection, but not 100%. Okay. Now, number 18, what are the common laboratory tests done to a pregnant mother? Please underline the word initially. Initially na linagyan pa ng first visit. So as soon as, can I just see some answers just to check whether this has been covered fully in your lectures? May I see some answers, please? Okay, so I see an A. Mostly I see an A. I see a B. Okay. Wala na. So A and B siya. Okay. So let's go into the common laboratory procedures. So initially, once you come for the first visit, these are the tests that we do. No? So, of course, how do we assess a woman sa prenatal visits niya? The first is, of course, getting the data. Data tayo, ha? The second, data or history and history. The second will be your physical examination. The nurse performs the physical exam face-to-face. And the third will be looking at the results of laboratory examinations, or lab exams. Okay? Including procedures like ultrasound, if mandated. Is ultrasound mandated on the first visit? Not necessarily. It is not an SOP unless there are questions of the age of gestation. Okay? So kung wala naman, at tingin namin ay okay, ito yung aming routine. So first muna, before I go into that sa lab exams, data muna. So we ask about the age, no? Remember, in order to detect if she's within the reproductive age, remember that risk is much, much lessened if the woman is within the reproductive age. We talk about calculating the Nagel's rule, the EDC. We talk about doing the OB scoring. We ask about the current pregnancy. We ask about the parity. Panganay ba, panglima, pang etc. Anong nangyari sa unang pagbubuntis? Meron bang bleeding? Suhi ba? Na CS ba siya? Another is, at this point, may history ka ba ng diabetes? Okay, so those are the data. Then you do the physical examination. So you do the physical examination from head to foot ng nanay. And then you do the only physical examination to assess the fetus. Remember, you have 2 clients, no? Is to do the Leopold's maneuver. So pasok sa physical exam yung Leopold's maneuver only to determine things concerning the fetus. Pero on concerning the mother, so i-check nyo yung conjunctiva, i-check nyo yung ngipin, yung thyroid mass, i-check nyo ang breast, check the fundic height, although this is related to the fetus, check the vulva, any secretions, any foul odor, any abrasions, any warts, any galis, any bruises, any varicosities, any bleeding. So that will also be checked on the legs as well. So yun ang titignan nyo. And then sa lab exams. So what are the lab exams? So first and foremost, we look at blood tests. Okay? And we look at your urine test. Okay? So sa blood test, primarily we take the CBC, particularly what in the CBC, hemoglobin level. I have said this again and again, pero we also would like to look at the blood type of the woman. Then we go into several usual. You have your Hep B, okay, and then you have your ELISA test, okay. This is routine, and you have of course your RPR test, rapid plasma reagent, which is a sister of VDRL. The VDRL is a more general, no, screening test for syphilis. The more specific is the RPR test. So we do the RPR now. And basing on your assessment, if you look at the status of the woman, then you may do a TB test for Filipinos. Ginagawa ito pag nakikita mong payat at inuubo-ubo. Sa TB test, we do not do x-rays, but we do skin testing and a possible sputum test. Kung gusto na natin dumiretso kasi mukhang medyo mabigat yung kanyang yung ubo niya. I believe she really has tuberculosis for the Filipinos. Okay? Sa urine naman, we test for bacteria primarily. As I said, UTI is a common urine problem, and we check for proteinuria as well. Proteinuria for preeclampsia, and we check for ketones for the possibility of primarily for dehydration or not. Okay? So, ito ang ating ginagawa. Initially, for the test. By the way, sa urine, of course, we check for sugar. But remember that pregnancy is diabetogenic. So a trace of sugar will not alarm us, or even +1. Pero if we really want to check for diabetes, kasi meron talaga siyang tendency, then we do the oral glucose challenge test sa first visit. Kung may history o kaya talagang diabetic siya. So we do the diabetic test immediately. However, if the woman is not, she is just normal, the usual ideal AOG for testing for diabetes is between 24 to 28 weeks sa third trimester, more or less. 6 to 7 months. Okay? Now, let me go to the blood test muna. Hemoglobin level, I explained yesterday, and I explained kanina. Now, another thing is we would like to see a blood type done on the mother on her first visit. So what is the blood type for? 2 things. First, the blood type is to assess her type, and we would already instruct the woman that during labor, when she is admitted, she needs to have 1 blood donor. So she needs to put 500 ml of the blood type, of her blood type in the bank, in our blood bank, in the event that she bleeds. Okay? However, if she is operated on, cesarean ang gagawin, then we ask the woman to deposit 3 bags of blood or 1,500 ml of blood for replacement for her cesarean. So ayan ang mga SOP namin. So that's the first reason why we do the blood type. The second blood type is to detect the possibility of a hemolytic disease between the mother and her fetus. Okay, hemolytic disease, ha? So there are 2 types of hemolytic disease. One will be your RH factor, negative for the mother, and the ABO factor, which is blood type O for the mother. So titignan natin ang blood type. So if the mother is blood type O, okay, libre na tayo except for the RH factor. But RH factor is not common in the Filipino woman. RH factor is more common sa mga mestizas, mga puti. Okay, and besides, if you plan your pregnancy, you will ask to be injected with Rogam to prevent it. Diba? Okay, so ABO, okay, if the mother's blood type is O, then you have a problem. If your blood type is not O, then you are safer. Clear? Now let's go to the fetus. So the fetus is born within the first 8 to 24 hours. The primary assessment sign that you will look for in the baby, aside from her breathing color, aside from her breathing, is the color. And what am I driving at? I am driving at the yellow discoloration within the first few hours of life, which is jaundice. Okay? Pag nag-jaundice ang baby, immediately there are 2 signs to think of. But the more serious sign is your what? Hemolytic disease that can kill the baby outright. Then the second thing is a possible severe infection, chorioamnionitis, etc. So are we clear? So yan ang unang ilong titignan mo. As I said, the baby is under the care of the maternity nurse generally, no? If that baby is in the hospital setting with the mother. So titignan nyo palagi the breathing as well as the color of the baby. Okay? So Hepa B, just to check kung may Hep B siya. ELISA test, as I said, is now a routine for HIV mothers. Increasing na po ang HIV sa Philippines, alarming to an alarming level. And the ones being infected are the younger ones. Report ito ni Secretary Vergere. Ha? And so, we're talking about health education as a simple means of prevention. And then lahat ng nanay should be tested for HIV for the sake of the healthcare providers as well. But remember, we have an HIV administrative order that it brings about a Data Privacy Act. Hindi ka basta-basta makakapag-HIV test without the consent of the woman. Hindi, and once na nagpa-HIV test siya, the woman alone has the choice to disclose the result if positive, no, to anyone. But in the hospital setting, lalo na pag sa mga lying in, yung mga birthing centers, this should be waived for the protection of the healthcare worker. Alam mo, may mga babaeng ayaw mag-disclose, pero pag yan talaga naman in-explain mo na they should be acceptable of the fact na positive sila para ma-prevent ang severe effects sa fetus at ma-treat na siya. Eventually, most of these women, if not all, will agree. Maliwanag ha? So those are our laboratory methods, no? So, number 1, urine testing for sugar and ketones. Yes, why not, no? Kaya lang, as I said, not primarily. Blood test for CBC is true. Blood test for RPR is true. Oral glucose test will only be done on the 2nd to the 3rd trimester of pregnancy. So your answer is boy. The better answer is boy. Okay? 19. In an MCN class, the teacher is explaining the interplay of hormones. Okay? The luteal phase, underline luteal, of the ovarian cycle is synonymous with the blank phase of the uterine cycle. Anong sagot? Fast answer. Anong sagot? Okay. Luteal phase is the blank of the uterine phase. Ala, ala, ala. Anong mga pinagsasabi nyo? Bakit iba-iba kayo? Oh, may A, may B, may C. Wala pang D. Of course. Okay. Ayan. Pero ayan, I'm getting the better answers. Okay. So remember, the follicular phase is synonymous or synchronous with the proliferative phase. The luteal phase is synonymous with the secretory phase. So the answer is letter C. So this will be LH and progesterone. Okay? Number 20, a woman in her 26 weeks AOG visits the prenatal clinic and circle the number 26. Anong significance sa 26 weeks? Viable na. Ang fetus, ma-appreciate mo na ang movement, yan. Maririnig mo na ang heart rate via the stethoscope, ayan. Everything is functional. The fetus is just growing rapidly to term and progressively, okay? Now, however, she explains of weakness and lightheadedness when lying on the examination table. What would be the primary nursing action? Napakadali lang nito. So pag ikaw nakahiga, bigla kang mahihilo at parang naglalighten. So what do? You will now turn the woman on her left side in order to relieve the pressure of the uterus on the bigger vessels para hindi mag-lighthead. Okay? Okay. So letter C. 21. Discussing the reproductive processes in a woman. So we discussed it kanina. Implantation in a regular cycle occurs on, can I see your answer? Kasi medyo, ano to, kailan ang implantation? So I'm getting a B, I am getting a D, I'm getting a C, pero maraming D. Okay. Okay, so look at, remember ha, look at your calendar. So we're going to talk about the concept of implantation. So, ayan. This is a regular calendar for a woman, no? 7. Okay. So these are the 4 weeks in the menstrual cycle. 1 to 7, 8 to 14, okay, 15 to 21, 21 to 28, ay 22 to 28. Very significant. Okay? So, sa 1 to 7, ilagay nyo dyan, menstrual week. Ito ang regla in the cycle. First day of your cycle. So, menstrual week. Okay? Yung 8 to 14, so rinegla ka ng 7, up to 7 days. Bigyan na natin yan. From 8 to 14, this is your pre-ovulatory period. So this is the time pag mag-i-increase na ang iyong estrogen, progesterone, because on the second week, especially on the 14th day, you have your ovulation week. Mag-o-ovulate ka. Okay? Now remember, ovulation kayo 14 days, hindi ba? Diba? So, fertilization immediately occurs on the 14th day before menstruation. Pag nag-fertilize yan, hindi agad yan mag-i-implant. From fertilization to implantation, it gives you 7 to 10 days. In some books, it will be 8 to 10 days. So you are given 7 or 8 to 10 days for the fertilized egg, okay, to develop into the implanting zygote, which is the blastocyst. So, fertilized egg, okay, then you have your blastomere, then you have your morula, then you have your blastocyst. So these are the stages of your zygote. Yan. So fertilized egg, 14 days. And as soon as it is fertilized, no, it will start moving in 3 to 4 days in the fallopian tube to become a blastomere and to become a 16-cell zygote, which we call morula. Pagdating sa uterus, sa upper portion, it will change into a two-cavity fertilized egg zygote, which we call the blastocyst. And that is the fertilized stage, and that is the stage of the zygote that implants. Bakit hindi maka-implant ang morula? Bakit hindi maka-implant ang blastomere, etc.? Kasi wala pa pong germ layers from which organs will emanate. So wala pang endoderm, exoderm, ectoderm, and mesoderm. By the time nag-blastocyst yan, magkakaroon na yan ng germ layers that will develop into organs. And that will be your implanting blastocyst. Okay. And ito yung sinabi ko sa inyo na sometimes from the travel of the fertilized egg to the uterus, nalalaglag siya. So we have an abortion, an early abortion. Okay? Now, so therefore, the implantation week will be what? The 3rd week of the cycle. The 3rd week of the cycle. Tapos pag na-implant na siya, it should be completed on the 10th day. There are some fertilized eggs na nag-implant ng 7 or 8, nag-uumpisa pa lang na mag-implant on 7 and 8. Pagdating ng 9th, laglag siya. Defective ang blastocyst. So you again have an abortion. The cause of abortion will be fetal defects. Are we clear, ha? Okay. And on the 4th week, pag nag-implant siya on the 3rd week, continuous na yan, progressive sa pregnancy. Or pag walang fertilization, tuloy-tuloy lang yan to menstruation again. Okay? After the 4th week, balik na naman tayo sa cycle. Okay? O, ayan. Nasaan na tayo? 22. As a safety protocol of the WHO, the DOH has adopted the following measures discussed with the mother on the first prenatal visit. Underline first. Prepare the birth plan with emergency preparedness. Encourage all pregnant women to deliver in the healthcare facility. Yes. The mother is given a choice as to her place of delivery. No. Underline the word choice. Remember kahapon sa Menchan, okay? Each pregnancy must deliver in a healthcare facility attended by skilled birth attendants. The safest way to deliver a baby is by a skilled birth attendant, preferably, and should be in a healthcare setting, whether it's primary or not. Okay? Discuss with her who will be her companion, who will take care of her kids at home, etc. Yes. So your answer is letter C, 1, 2, and 4. Okay? 1, 2, and 4. Letter C. Maliwanag ha? So we have a birth plan that is done initially at the first visit, discussed with the mother, and is checked every visit. Chine-check na ng SBA yan kung yun pa rin ang plano. Kasi if something occurs, nag-iba ang assessment mo sa nanay, the birth plan now changes. And so one of the characteristic of the birth plan is it is flexible. Nababago siya based on the assessment, on your assessment sa nanay. Okay? Now, number 23. Adolescent pregnancy has been increasing as per report of the Population Commission of the Philippines. The initial, check nyo yan, the initial underlying responsibility in teaching the adolescent patient is, alam nyo, we have a Welcome Teens Clinic in Fabelia. We established that. Kami ang nag-establish nun. Our focus sa Welcome Teens, it is W-E-L-L tapos teens, no? We would like to remove the stigma that goes with adolescent pregnancy. And so our director mandated us to develop a clinic that will provide a one-stop shop for adolescents who are pregnant para hindi sila maihalo sa normal at sila ay mahihiya sa kakatanong ng mga kasamahan niya kung buntis ba siya o hindi. So sa private room where we do or we examine adolescents. Based on our census, however, kung nakaka-60 kami sa prenatal clinic of sa normal prenatal clinic, 60 kami, then 30 sa high risk. Pagdating sa welcome teens, meron lang kaming isa, dalawa, or sometimes 0. So, one of the seemingly attitudes, no, of an adolescent buntis is she does not go for checkup. Okay? And so here, your emphasis and initial responsibility is to letter C. Emphasize the importance of consistent, regular prenatal checkup. Okay? Emphasize the importance of a regular prenatal checkup. Yun ang number 1 na ipupukpok mo sa ulo. Bago yung information on breastfeeding, bago information. Danger signs would be good. O danger signs nga hindi ka naman binabalakan, wala rin. Ha? Teaching her about family planning, okay yan. But at the end of the day, you will always tell her, I will see you on ganito with a definite date written on her appointment card para talagang bumalik. And you know what the midwives do sa lying-in nila? Kaya pabalik-balik ang clients nila. You know what they do? Aside from that, pag hindi na bumalik, for example, chine-check nila lahat ang kanilang clients' return visit. Now, if for example, one client is supposed to have been to have returned yesterday at hindi pa, the midwife will start calling the pregnant woman. Hey, you miss your checkup. Halika na dito. Are you okay? Are you sick? Would you want me to go there and do my visit to you? Pwedeng i-home visit kita. Ganon katutok ang midwives sa kanilang mga clients. And so therefore, the clients feel very personal. They feel up close and personal to the midwife. Kaya pabalik-balik din sila doon sa midwife na yon. Are we clear, ha? Okay, so emphasize the importance of a regular, consistent prenatal checkup. Okay? By the way, no, per WHO, ang sabi nila noon sa MDGs, no, was there should be 4 minimum visits, 1 in the first trimester around 12 weeks, another one at 26 weeks, another one at 32 weeks, and last one at term. Now, hopefully, this should have reduced maternal problems, pero hindi nangyari. And so, binabalik uli ng WHO in 2018 or 2016, ibalik uli siya sa monthly. So, 8 visits ang ini-impose ng WHO for a safer pregnancy and delivery. So, 8 visits, which is actually parang monthly na. Okay? So, if the woman does not fulfill her visits regularly, now, if you can just devise a strategy to follow up, just to ask questions. How are you? One private hospital does that Meron silang lahat ng contact numbers, meron silang their customer service department would call and say, how are you? Would you like lahat-lahat yan for safer delivery. Okay? Now let's go to 24. Which important milestone generally occurs on the 5th month of pregnancy? Milestones. Okay? So milestones, anong sagot? Okay. Okay. So no problem. Looks like you all know the concept of viability. Very good. Okay, next. Number 25. Let's go to accessories in pregnancy. Okay. So, let's go to the basic concept. There are passengers in labor, or there are passengers in labor. So, once nagpaanak kayo, see to it that the following are expelled, and these are your passengers. Primary passenger mo, so these are the 5 passengers. Clear? So, bakit ma'am hinimay-himay-himay? Why did we separate one from the other when they are related? Which are the related passengers? Placenta and membranes and cord. These are the related passengers. Bakit? Because each one of these independently can create a problem. Okay, each one of the parts of the placenta can create a problem. Okay, so for example, let's go first into the 5 passengers. What are the problems that can cause dystocia or difficult labor caused by the passengers? So sa fetus, anong number 1 na problema mo? Will be a macrosomic baby or malpresentation. Pag nag-transverse lie ka, automatic CS ka na. Okay? Okay, so that's one. Sa placenta, what can be a problem that can cause dystocia? Previa abruptio, adherent placenta, acrita, percrita, incrita, yung mga ayaw matanggal. Okay? Then on the amniotic fluid, what are the factors that can cause dystocia? Okay, you have oligo and polyhydramnios. So pag polyhydram, by the way, any abnormality of the amniotic fluid, no, warrants a thorough infection on the baby because it's 90% producing congenital anomalies. Remember that it is the fetus that brings about or that develops your amniotic fluid. So kung konti yan o madami, may problema doon sa fetus. Clear? And then, what also? Oligohydramnios, polyhydramnios can cause problems, okay, or dystocia. And then you have the membranes. What are the 2 types of membranes? Si chorion and si amnion. So si chorion is the thicker membrane, si amnion is the thinner membrane. Anong problema natin sa chorion? Minsan we have what we call adherent membranes. Nakadikit siya sa endometrium, no? Or sa decidua. So hindi mo siya matatanggal lang. And remember, the chorion is the more common type of membrane that is usually retained during placental expulsion. So ito yung pinapasok ng doktor yung kamay niya at hinahalukay niya ng ganyan, hinahalukay para tanggalin ang thicker portion, which is the membrane, to complete the placenta. And then the cord. What in the cord is a condition that can cause dystocia. Ihos, a short cord can cause abruptio. Pag short ang cord at umikot ang fetus, pwedeng mahila ang placenta. Or a long cord can cause cord loops. No? Ilang beses nakakaano. Every time iikot siya, magkakaroon ng knots. Okay? So may problema ka. So what is the ideal cord? Kailangan 50 centimeters or this is what one consultant said in one of our briefings. No, the cord should be as long as the baby's length. If it is shorter, too short, it can cause damage. If it is too long, it can cause damage. Okay, so those are the factors, no, that can cause dystocia caused by the 5 passengers. So dito sa question na ito, no, sa placenta, no, we're talking of placenta as an accessory organ of pregnancy. So what are the accessory organs of pregnancy? You have the placenta, you have the amniotic fluid, and you have, of course, the parts of the placenta like the membranes and the cord. Yun ang accessory organs. Now, okay, placenta, what are the parts of the placenta? Dalawa. Hindi yan ano ha, hindi yan amnion chorion. Hindi rin yan fetal and maternal sides. Now, the answers, the 2 parts of the placenta will be your cotyledon, yung bilog-bilog siya, na nakadikit sa decidua basalis. At yung opposite ng placenta na yan is your membranes. Yun yung membranes, yung merong mga ano, yung merong mga ugat-ugat with the cord attached to the baby. So the membranes and the cord will be in the fetal side. The cotyledons will be on the maternal side. So yan, parts of the placenta. What are the functions of the placenta? Number 1 is respiratory, nutritive, excretory, immunologic, barrier. So immunologic means sa placenta nang gagaling ang antibodies papunta sa baby. Saan galing si antibodies? Sa nanay, sa mother. Kaya nga itong sinasabi natin, the time when antibodies are transferred from the mother to the fetus is during the 3rd trimester. Clear? So if the baby is born, alanganin, pinanganak yung baby 7 months, 6 months, 7.5 months, hindi pa kumpleto yung antibodies na pupunta sa bata. Kaya that baby is highly prone to infection. There are no antibodies to protect him. So yan. Another function of the placenta is the barrier. What do you mean by barrier? No? It closes, no? Sinasara lahat. Anong sinasara ng placenta? Sinasara niya ang kanyang what? Ang kanyang organ from invasion by bacteria. So hindi makapasok ang bacteria sa placenta. Kasi it bars, it stops. Pero there is one na talagang grabe na pwedeng pumasok. And what is that? The viruses. So viruses can enter the placenta and can cause damage to the fetus. And that's the reason why we would like the mother to be vaccinated prior to pregnancy. Clear? Isa lang ang hindi maaano, no? So hindi kaya ng placenta ang placenta can bar bacteria except isa. Ano ang hindi pwedeng i-bar ng placenta? Syphilis. We have congenital syphilis, no? Okay. Pero lahat ng viruses can enter the placental barrier except one. Isa pa lang, no? Ano yun? The COVID vaccine. The COVID virus. The COVID virus has not been found to be present in the placenta. It has not been found to cause COVID infection sa baby ng isang buntis. Kasi nga bago pa ito it's new. We have not gone into full researches. So far, ang sabi natin, okay, yung COVID na yan, it will not affect the fetus until the baby is born. Pag lumabas ang baby, yan na. Because the fetus will now be able to inhale and take in viruses from either the mother or the caregiver or the nurse or the midwife. The coronavirus has not still been found in the breast milk of the baby. And so we fully recommend full blast breastfeeding to the COVID mother on her COVID baby. Okay? So these are the things that we are talking about when it comes to your placental barrier. And so what is your answer? Tignan ko nga, anong sinagot niyo dito? So letter B, letter B, letter B. True. So lahat kayo correct for letter B. Then we go to Leopold's maneuver. Gusto ko lang makita kung okay na kayo dito. So number 26, please. Can you just answer letter C? Nasabi ko na, letter C. Tama. Oo. Diyos ko, nabubulol na ako. Mainit na kasi. I feel the humidity. Yeah, letter C. Okay. I feel the humidity. Nararamdaman ko na. Okay. So letter C is the answer. Okay, what is letter C? Right occipito anterior longitudinal lie. Okay, so let's go. Soft, mass, pero firm sa fundus is the buttocks. So pag buttocks yan, ang nasa fundus, what is in the lower segment? Occiput. Opposite of the occiput is the bridge, no? Okay. Now, eto lang, protrusions and knots on the left side. So the protrusions will be your elbow, your knee, your wrist, your hands. Nasa left side daw ng nanay. So remember, ako na lang, ito yung aking protrusions, ito yung aking likod. So it's opposite. So if this one is appreciated on the left side, ano ang nasa right side? The back and the occiput. And so your answer, we will assume that it will be LOA kasi most presentations are 95% cephalic and anterior. Okay, so your answer is letter C. Now, in relation to this, my dears, okay, since we are after the fetus, in relation to this, please take note of the following terms. Presentation, presenting part, lie, okay, attitude, okay, attitude, position. So again, presentation, presenting part, lie, attitude, position, may isa pa ako nalimutan, station. So these are the terms that are always related to your assessment in the fetus. So sa presentation, you have 3, cephalic vertex or occiput, bridge, and shoulder, not transverse, shoulder presentation. Sa presenting part, you have the occiput, okay, you have the sacrum, and you have the scapula or the acromion. Okay, so yan. Sa lie, you have your longitudinal and your transverse. Okay, and then sa attitude, you have the well flexed and your completely flexed, completely extended, partially flexed, partially extended head. Kasi flexion ang attitude. And then your station will be above the ischial spine minus, below the ischial spine plus. And then of course, your position, your best position of course will be your LOA. Okay. Next, we go to number 27. So number 27, a primee unsure of her LMP is told that she appears to be 7 months pregnant. Why do you think this is so? Why do you think this is so? Okay, can I look at your answers? Bakit sa tingin mo, ano ka agad? Sa 27. Okay. Okay, so no problem. You are perfect. The answer is letter B. 28 centimeters and the fetal heartbeat can be assessed through the stethoscope. So there is a rule that states that when it reaches the age, a certain age of gestation, it is equivalent to the fundic height that you get. No? So usually, pagdating ng 27-28 sa Filipino, 29-30, pag 30 cm yan, then 30 weeks gestation or something. Pero it stops there. Okay? So usually it stops there. And for the Filipino woman, sa clinical assessment, the usual numbers that we get for the fundic height will be between 29 to 31 centimeters fundic height in labor. In labor. So ibig sabihin, pag in labor, naka-engage na siya, nakapasok na siya. So the fundic height must be less than the fundic height that you get in pregnancy, where the fetus is still floating. Okay? So, assessment namin noon clinically, if the assessment that we got was 29 cm in labor, we are happy that fetus will be expelled without difficulty. Pag yan nasa 30, okay lang. Pag yan nasa 31, medyo alerto na kami, nagbo-borderline na siya. Maliwanag. Sa fundic height lang in labor. I will have to tell you and share with you something that happened again in clinical practice. Ano yun? Dumating yung pasyente, okay, dumating ang pasyente, nakahang ang ulo. Hang ang ulo, dito, patay ang baby. Okay, patay ang baby, nakahang. Pag ganyan na, nakahang ang ulo, okay, what was the main cause of death? Asphyxia. Why? Because of shoulder dystocia. Hindi umikot yung shoulder sa internal rotation. What is the main reason for that? Because of what? Macrosomia. Malaki ang fetus. Okay, this was handled lying in by a midwife. Okay, alam mo pag ganyan, ang midwives will not come with their patients Inuutusan na lang nila yung asawa at saka yung pasyente to run to us. Kasi sigurado mapapagalitan siya. Okay? Apparently, based on what we gathered, okay, nag-fundic height naman yung fetus. Nag-fundic height yung, nag-fundic height naman yung nanay. Ang nakuha ng midwife was 33 centimeters. 33 centimeters. That should have been a red flag already. Pero tinuloy pa rin niya. Why? Tinawagan niya yung kanyang yung kamowa niya na doktor. Doktora, 33 cm, malaki ho ang bata. Alam ng midwife na malaki. Ano sabi ng doktora? Sige, sige, hayaan mo lang. Lalabas din yan. Papunta na ako dyan. Okay, lumabas nga ulo, nabitin naman. So what am I saying? Sa 31 cm pa lang, humanda na kayo. Kasi 31 cm for the Filipino woman, Filipino kasi pag Amerikana to, British to, kaya. Okay? Is lalo na if the woman is petite, cute, no? Mga 5'1", 5'2". Okay? Pag 31 cm na niya, umalalay na kayo. Kasi baka magkaroon ng arrest of the shoulders, which will give you a problem. Are we clear So the fundic height is very, very important as well. Okay? Now, number 28, when taking the health history of the pregnant mother, the nurse recognizes that she would be at risk for developing preeclampsia if she is, ayan, nakuha na natin ito lahat, Okay, if she is letter, I'm getting the answers, and you are correct, if she is overweight and primigravida. Bantayan nyo yan. So A is ideal. C, 6 pregnancies has no bearing. And letter D, has been on contraceptives within 3 months of conception. has no bearing. Okay? Now, number 29. These conditions are expected to occur in teenage pregnancy. Madali na lang ito kasi nakuha na natin ito kanina or kahapon, no? So, placenta previa ba? Is this a risk for the adolescent pregnancy? Cephalopelvic, yes. We are not sure. Okay? Chromosomal abnormalities, we are not sure. Preeclampsia, yes, we are sure. So your answer will be letter dog, 2 and 4. Clear? Ay, sorry. C. 2 and 4. Bear with my ano ha, kasi ganun ako eh ha. So nalilito, may typographical eyesight din ako ha. Okay, so that should be cephalopelvic disproportion and preeclampsia. Placenta previa, what is the cause of placenta previa? Placenta previa is what? Is caused by diminution of blood supply to the area of attachment. Okay? And what do I mean by that? Nagninipis yung decidua, no? So that attachment will not be very ideal. Sabi ko sa inyo, matalino ang fetus. Pag yan previously attached na yan, hindi na yan mag-i-implant ng kanyang placenta. Bababa siya. Titingin siya ng matatabang lupa or matabang decidua. Clear? So matalinong fetus, no? So if she sees na may previously implanted na dyan, kasi may scarring dyan eh. May scarring of the tissues. Hindi na yan mag-a-attach. It will look for another. So it will attach on a fertile and fresh decidua. And so and so. Sa prime naman, wala pa namang previous attachment yan. Prime parang yan. So anywhere in the fundal area is an ideal site of implantation. So therefore, malayo ang previa sa kanya. Sa multigravida yan, common. Okay? So common ang placenta previa, more on the multigravida. Okay? Another, common siya sa malpresentation. If the baby is, tawag mo ito, breech, nakatayo, mai-implant yung kanyang placenta sa lower segment. Okay? Common siya. Okay? Common siya sa repeated DNC, sa kakakayod, nagninipis ang decidua. Are we clear? Okay, so hindi ang placenta previa and chromosomal abnormalities I explained earlier, it is more common sa elderly because of elderly eggs. Elderly eggs. Okay? So ayan. Number 30. Theoretically, nasabi ko na to kanina, the following hormones increase to initiate the onset of labor except, and circle the word except, the secretion of which hormone? Alam niyo na ang sagot, di ba? Ang kontrabida lang sa apat na yan is your progesterone. Letter C. Because progesterone relaxes and balances the action of the three. So if the progesterone is withdrawn, bumagsak, then contractions begin and labor begins. And this is the basis of your progesterone withdrawal theory of labor. Okay? So relaxin is a hormone that relaxes or that creates relaxes the lumbosacral part para mas madaling mag-stretch in labor. Fetal corticosteroids are tawag dito, more or less hormone-like substances produced by the fetus when that fetus is about to be delivered, and it contracts the uterus as well. Then we go to situation. A 26-year-old primey is admitted in labor at 8 a.m. Please take note of your positions, of your data. The position is ROP. Anong ibig sabihin ng ROP? Right occipito posterior. The cervical dilatation is 6 cm. Okay? And the bag of water is ruptured. Paano mo alam? Negative. Negative ang bag of water. Now, number 1 question. With a negative bag of water, what should the nurse instruct the mother? Answer. Okay. So answer is B. She must stay on bed, left side lying. Okay. She can eat anything for as long as it is light diet is true. Pwedeng kumain ang normal woman in labor. She can move around anytime as she pleases is true. Mobility is an important factor in shortening labor. She needs oxygen inhalation 3 to 5 liters to ensure the baby's safety. Not at this point. You need a valid reason to give oxygen to the woman. And what is that? The heart rate. Now, when are you supposed to give oxygenation? When the heart rate increases to more than 160. Wag niyong antayin na bumagsak ang heart rate sa 100 or 90. Kasi the early sign of fetal distress is an increasing heart rate. Now, your decreasing heart rate of 100, then 98, then 95 is a late sign. Generally, pag ganon, wala na tayong magagawa. I-OR na natin, ilabas na natin ang bata. Okay? And of course, you know very well that oxygen inhalation should be ordered. It's a dependent function. Okay? And so with this, in labor, we have the following. Sa labor, now, essential intrapartal newborn care has 2 facets or 2 stages. The first phase, PHASE, is on the mother, which we call EIC, without the N, essential intrapartal care. The second phase is on the baby, with essential newborn care. Wala na tayong problema sa ENC. Apparently, all of you are oriented to the ENC procedure, which you do after the baby is born. Now, the ENC are the time-framed procedure that we do to the newborn baby. Pero meron tayong tinatawag na EIC. Meron tayong tinatawag na EIC. Ay, pareho. Paki-correct. Essential intrapartal care. Burahin nyo yung naroon, ha? Essential intrapartal care at saka essential newborn care. Sa first stage of labor, our essential intrapartal care are the following. Kasi per stage meron. What are the essential intrapartal care? Sa labor, number 1, the woman can be moving around. Mobility of the mother. Okay? Number 2, the woman can be given a light diet. Huwag kayong mamiesta sa labor room. Huwag kayong magdala ng mga morcon, lechon, hindi yan. But light diet, like what is the favorite of the Filipino women? No? Ito yung mga sopas nila. Ito yung mga arroz caldo, goto, no? Noodles, favorite niyo yan. Kahit kayo, mahilig mag-noodles. No? And so noodles, pwedeng kumain. Okay? What else? No? So, mobile ang nanay for as long as intact ang bag. Number 2, can eat light carbohydrates. Number 3, okay. Number 3, pain relief. The mother is entitled to pain relief. Number 4, the use of the partograph. And number 5, a positive birth environment provides a companion in labor. Ayun. So ngayon, these are the 5 EIC practices, no, in the first stage of labor. So pag upright and mobile ang nanay, kasi intact ang bag, labor will be shorter because the baby will descend faster. Pag kumakain ang nanay, the mother is given the energy to push in the second stage of labor, not in the first stage. So meron siyang energy to push. If the mother, of course, the use of the partograph is very, very significant as we talked about it yesterday. And then pain relief. There are 2 types of pain relief, non-pharmacologic and pharmacologic. So yung non-pharmacologic, independent yan. Pag nakita mong nasasaktan ang nanay, the nurse can initiate or instigate the use of the breathing techniques to relieve pain. Okay? O, Mrs. Hinga ng malalim. Inhale, exhale. Inhale, exhale. That relaxes the muscles that will more or less reduce the pain. Or, yung focus ng nanay doon, ang belief niya is, pag siya'y huminga talaga, the sight of the mother will make her feel that the pain is what? Being reduced or minimized. Kung hindi na pwede at makita mong wa-effect talaga, then be an advocate of the mother. Look for a doctor's order for pain relief. And so, mag-o-order ang doktor ng either meperidine, hydrochloride, or demerol, o kaya nifedipine. Okay? Or Nubain. Okay? Nubain. Maliwanag, ha? So, nagbibigay tayo ng drugs to relieve the pain in labor. Again, we have policies regarding pain relief. Okay? And of course, ano pang sinabi ko? Pain relief and the companion. The companion, marami ng research, marami ng evidence-based, no? Reasons that say that the companion in labor reduces the pain, provides emotional support. So therefore, labor is shorter and becomes more normal. Yan ang EIC practices in the first stage of labor. EIC practices in the second stage. Number 1, no fundal pushing, no fundal pressure. Ang EIC practice there is allow the mother to do spontaneous pushing when contractions are there. Reflex lang ng nanay, wag mong ipupush. The second is, the mother can assume the most feasible. Feasible, ha? The mother should assume the most feasible position. And the best position should be an upright squatting position, kung kaya. Kung hindi naman, wag lang full lithotomy. Semi-upright, naka-elevate ang kanyang head and trunk, tapos naka-lithotomy ang kanyang legs, no? So yan, EIC practice. And episiotomy is never a routine. Episiotomy is now considered to be a choice and only when indicated. So EIC practice yan ng second stage. On the third stage of labor, the EIC practice is the active management of the third stage of labor. Yan, EIC practice yan. Okay? Ano yung third stage? Ano yung active management? There are 2 types to manage the third stage of labor. One is the expected or the traditional management, and the second is the active management. Okay? So anong difference nung expected? Ito yung ginagawa ng midwives. Number 1, wait for signs of placental separation. Calkins, lengthening, gushing of the blood. Pag may signs na, anong gagawin ng midwife? Expel the placenta. Okay? Through controlled cord traction. After the placenta is expelled, anong gagawin? Number 3, inject the oxytocin. After injection of oxytocin, massage gently the uterus. So yan ang procedure for the expected management. On the other hand, ito ang ina-advocate ng WHO-DOH, active management. Anong difference? Number 1, as soon as the baby is out and ruling out a second baby, walang twins, walang triplets, automatic mag-inject ng oxytocin. Clear? And then after injection of the oxytocin will hasten the contraction and will hasten the separation of the placenta from the decidua. So the second is you're now going to expel the placenta, no? You're now going to expel the placenta from the uterus using the controlled contraction. And the third is after placental expulsion, massage the uterus in a circular, gentle manner. So yun ang difference. Maliwanag? The active management of the third stage of labor, okay, shortens the hours that the mother is in the third stage. Remember, kahapon ko pa sinasabi, for as long as the placenta is inside the uterus, after the delivery of the baby, it becomes a foreign body. And the uterus will not contract, the uterus will bleed until the placenta is completely expelled. Okay? So, maliwanag ba yon? Yun ang mga EIC practices ng nanay. ENC practices, alam nyo na yung 4 core steps. Drying in 30 seconds, skin-to-skin contact, sequence to ha. Okay, cord pulsation, 1 to 3 minutes. Wait for it to stop before you cut the cord in 1 to 3 minutes. And the fourth is you do not separate the woman from the baby for at least 90 minutes. What is the reason? Aside from bonding, in order to initiate breastfeeding. Okay, so doon sa drying, dalawa ang iyong reason: to prevent hypothermia and to stimulate crying. Sa skin-to-skin, continuation of prevention of hypothermia, and then of course the bonding and the prevention of infection. Paano ma'am na-prevent ng infection? The good bacteria from the mother's skin is transferred to the baby's skin, thereby protecting the skin of the baby. Also, the third is wait for the pulsation of the cord to stop before cutting. Anong reason natin ito? To add more blood to the fetus, around 80 to 100 ml of blood still goes to the fetus, preventing or reducing anemia postnatally, and to prevent intraventricular rupture of the meningeal membranes of the brain, preventing brain bleeding. Okay? And the fourth is continue bonding, continue preventing hypothermia, and initiating breastfeeding. So those are the reasons talaga why we do ENC. Then, while waiting for that 90 minutes, no, waiting for the unang embrace, unang yakap, we do the following. Anong ginagawa natin? We do our regular immediate routine procedure. Rabies prophylaxis, injection of Vita K and Hep B vaccine, okay, anthropometric measurements, the weight of the baby, the CH, the CC, taking the initial temperature of the baby. By the way, the temperature of the baby should be 36 to 37 degrees. Any temperature below 35 needs, okay, additional warmth, either a radiant warmer, a kangaroo care, yung kangaroo, ginaganyan nyo, ini-embrace ng nanay, or an incubator para hindi magkaroon ng hypoglycemia. Are we clear? And the baby must be fed with breast milk within 24 hours. Otherwise, the baby might go into a hypoglycemic state that can kill the baby. a lot of our seeds death, no, sudden infant death syndrome, okay, have been diagnosed as SIDS only to find out upon autopsy na ang cause of death is hypoglycemia. So what do we do? Kaya nga kailangan mag-breastfeed ang nanay na. Kung wala pang gatas, responsibility of the nurse is to provide human breast milk through what? Through the dropper or through the spoon or through the cup, para lang magkaroon siya ng, ang tawag nito, ng feeding yung baby natin. It is a mortal sin not to feed our babies within 24 hours. So ayan ha, nasabi ko ng EIC, nasabi ko na ang EMC. Okay, next, number 26. Ay hindi, ano ka ba? Number, ano na tayo? 32. Kasi pala yung 31, the reason why I discussed the EIC is because some of the choices are EIC practices. So 32, ROP, right occiput posterior position, would let the nurse inform the woman ano ang significance ng posterior position that you should tell your mother. Anong sagot nyo? I see a B and a C. I see a B and a C. I see mainly a C, a letter C. O, sige, tignan natin. ROP position. That means to say, the presenting part, which is the occiput, is at the back part of the pelvis. Nasa sacrum. Kaya nga ROP. And so what happens is, remember that in the delivery process, the occiput should impinge. This is your symphysis pubis. Ito yung ulo. Granting this is the occiput, ha? Ito, symphysis pubis. Ito ang occiput. Can you see the occiput? Ayan. Naku, ayan, ayan. Okay? So if you see, never mind. Frustrated ako. Okay. Can you see? My occiput anterior and my occiput posterior. So, your presenting part is ito. Ito ang presenting part nyo. So, ito siya. It's in the posterior position. Dito sa anterior position, your presenting part is this. Now, in the delivery process, dapat ganyan. Dapat ganyan. The occiput must impinge below the symphysis pubis in order to extend. Okay? So, if it is in an anterior position, it will only take a few minutes for the occiput to impinge itself and assume this position. Whereas, kung ito ay posterior, it will take several hours even, or minutes, or sometimes hour in order to take this position. So in other words, in the internal rotation of the fetus, okay, will take you longer. So will take you longer. So longer ang second stage, and sa rotation yan, pag longer ang second stage of labor, mas masakit ang second stage. So therefore, letter B is the correct answer. Are we clear? Okay. So, occipito-posterior positions, ang problema nyo is in the internal rotation of the fetal head. Are we clear? Then we go to number 33. We go to contraction. Okay. So, number 33, we go to contraction. Mid-pelvic capacity of the pelvis may be measured by mid-pelvic capacity. So, mid-pelvis, how do you measure the ischial spine? Sinabi ko to sa inyo kanina. The answer is letter number 33, clinical measurements of the ischial spines through IE. So, aside from measuring the diagonal conjugate, you can also measure the ischial spines, no, by means of internal examination. So your answer is letter C. And what are we looking at to be normal? It should be 10 cm above because the passenger, okay, measures 9.5 SOB diameter. So 9.5 ang measurement ng ulo, kakasya yan sa OB conjugate na 10, kakasya yan sa ischial spines diameter na 10. Okay? OB conjugate cannot be directly measured. It can only be measured through the diagonal conjugate by subtracting 1.5 centimeters. Okay? Now, number 34, in the second stage of labor, expulsion of the fetus from the birth canal depends on which important factor? I want some answers para makita ko kung ano. Subtract. By which factor? Naku, I see an A generally. Okay. Uy, in the second stage of labor, expulsion of the fetus will depend only on which important factor. Your answer is letter boy, maternal pushing down. Bakit hindi A? My dears, underline nyo ang second stage. Sa second stage na yan, fully dilated na ang cervix. Clear? Fully na yan. So, bakit mo pa sasagutin ang full dilatation kung talagang buka na? So, anong factor doon? Uterine contraction? Yes, I agree. Pero, in the second stage, napaka-importante yung voluntary, forceful bearing down of the mother to assist the involuntary uterine contraction. Are we clear? Okay. So, if the mother cannot push, anong reason ko minsan? Number 1, gutom. Hindi kumain since last night na nag-labor na. Kaya nga pinapakain natin. Okay? Or ang tawag nito, aside from gutom, puyat, nanlalambot kasi prolonged labor na. But pag prolonged labor na to, we do not anymore go into a possible normal delivery. We're now going into assisted delivery by augmenting contractions with oxytocin drips. Okay? So ayan ha. So maternal pushing down. And that's the reason why pag hindi makairi ang nanay sa second stage of labor, anong ginagawa ng mga doktor? Fundal pressure. But fundal pressure is a no-no. Kasi ang effect, number 1, alam nyo, yung aming mga neonatal doctors, galit na galit sa mga obstetricians. Kasi pag finundal pressure na nila yan, lalabas ang baby asphyxiated. So itatakbo na naman ng nurse sa resuscitation area, i-resuscitate, tapos ibibigay sa NICU. Doon sa NICU's admitting doctor will really get mad and say, what did you do again? Oh, finundal pressure. So on the side of the baby, asphyxia or trauma. Baka naman sa pupush na ganyan, mabalian yung bata. Now, on the part of the mother, we have what? Abruptio placenta, because you push on the fundus where the placenta is attached. So you may be harming the placenta, or baka mamaya mag-rupture ka ng uterus. Because of the force, pati ang baby, ma-force mo na mag-rupture ang uterus sa lower segment. So you have uterine rupture. So mortal sin ang mag-fundal pressure. Okay? And 35, okay? As the head descends and crowns, supporting the perineum will facilitate, sige nga, last, let me see, answer, para tignan ko. Okay. Naku, ang daming mga sagot. Okay, as the head descends and crowns. You know what crowning means? You know the difference between crowning and bulging. Okay? So, the beauty of crowning is that the what to call this, the diameter of the head is already at the vaginal canal. Hindi na yan babalik. So therefore, this is the best time to deliver the head of the baby, and this is the best time. If you need to do an episiotomy, is to do the episiotomy. Okay? So, extend, when the head crowns, you do this maneuver. Ayan. What is this maneuver? Röntgen's maneuver. And the Röntgen's maneuver will now assist the perineum to extend the head. So the answer is letter C. Okay? So, as much as possible, the skilled birth attendant will deliver the fetal head. And the woman should not be pushing at the time after crowning. Kasi if the woman pushes even during crowning and a contraction, laceration yan kahit gravida 4 or 5. Noong nagtataka kami, bakit ba naglalacerate gravida 4 na? Yung pala, no? We discovered and we learned through hard way na yung pag-iri ng nanay at the time of crowning will definitely bring about lacerations. Okay? So, I will stop at this point. Okay, 35 Bukas tapusin natin to. And let me get back to a few minutes of question and answer. Sino to? Feds.
Yes, ma'am. Yes po.
I am ready for the question and answer portion.
Okay, ma'am. Okay po.
Tinitignan ko ito. Okay. Bakit po parang sa mga lying in na nagdutihan namin parang bawal kumain kasi baka tumais si nanay? Diyos ko po, this is a traditional reason. Kung hindi pa pinapakain yung nanay sa lying in, assumption natin normal yan hindi po updated yung midwife. I'm sorry to say this. Kung ako yan, pupuntahan ko yan at pipick upan ko at le-lecturean ko. At this is what they teach at the BIMO. Bakit hindi niya sinusunod? So if ever she does this, I'm sorry for saying this. This is only for her own sake, para hindi siya madumihan at hindi siya maglinis. Maliwanag. Pakainin mo yan para merong effort sa pag-ire. Sige. Okay? Mali yun para hindi tumain, wag pakainin. Diyos ko, old school of thought. Yung malaking janitor na pa ang gumawa sa akin. True. Talagang yung attendant or si Manong ang pinagfufundal measure nila noong araw. Kasi malakas si Manong. Pero my dears, at this point, di ba bawal na ngang mamalo? Ganun din sa pagpapaanak. Bawal na rin, maging violent sa pagpapaanak. My goodness, we are now promulgating a positive childbirth environment. Kasama yan. Diyos ko, I am a senior citizen and yet I update myself. Updated ako sa lahat na dapat gawin. So yung mga midwife na yan, naku, sorry ha, pero hindi bale, sige, sumbong niyo ako, I will answer. They should update themselves and they should follow what is being taught to them. Ha? Okay. Kaya nga may updates eh. Doon ko nalaman na kasama sa ang janitor sa team ng medical. Yung janitor kasama sa team because of infection control. Yun lang yun. At safety. Yun yun. Pero hindi para mag-push. Alam nyo, this is what I say time and again. Doctors are so impatient. Nurses and midwives should be the opposite of doctors. Patient tayo. We are at the bedside 24/7, not 24/7 rotation. Ang doktor kasi napaka-precious ng kanyang time. But my dear, she is handling the life of a woman. Ako noon, pag nasa DR ako noon at naggaganon doktor, sasabihin ko, Doktor, hindi ko sinasabi ng malakas ha, kasi maririnig ng nanay. Tumatabi ako, doktor. Sinabi ko, Doktor, bawal yan. Sige ka, bawal. Tapos sasabihin niya, akong bahala. Sige, bahala siya. O, mamaya-maya, sinusugad na siya ng pediatrician namin at nag-aaway na sila. Okay. Okay. So, Feds, I think, wala na. Thank you very much. Pag twins, here is a question. Paano po ang counting na parity? Ay sus. Okay. The counting of parity sa twins is still 1. Makakount ang twins mo sa living children. Are we clear? Makakount ang twins mo or ang multiple pregnancy mo sa living children. So, I will give you an example. Nakita nyo? Grabe daw 1 para 1, term siya, hindi preterm, hindi abortion, 2 living children. So doon mo makikita sa L na twins pala yon. Pero pinagbuntis lang siya minsan at halos magkasunod. Our delivery is only 1. Nanganak siya at one time na 2 ang lumabas. Okay? So just to be clear, ha? Parity is considered 1. Okay. Okay, here, may nagtanong. May anesthesia po ba pag nanganganak? Okay. I talked about non-pharmacological and I talk about pharmacological. Our positive childbirth experience na concept is we will try to make the experience of the woman as natural as possible. So ayaw natin ng anesthesia kasi kahit papano kung nagkamali ng timing, affected ang fetus. Okay? Pero sa high risk, of course, and if the mother requests, and if you are in a highfalutin JCI level 3 medical center, you will ask for anesthesia. So what is the best anesthesia that we do? Epidural anesthesia. Yan ang tinatawag namin na painless. Okay? So epidural anesthesia ang binibigay. But once binigay ang anesthesia na yan, nasa tabi mo na ang anesthesiologist up until you deliver the baby. Watch out pag nabigyan yan ng analgesic, pag binigyan yan ng anesthetic, please watch the fetus. Okay? Kasi sometimes pag nabigyan na yan, what happens is hindi na magna-natural cardinal movement ang fetus kasi inaantok na, tulog na yung bata. So paglabas ng fetus, you need to check whether that fetus is asphyxiated or not. So you need to resuscitate. Okay? Pero kung maagap naman ng doktor, naka-epidural ka, paglabas mo, automatic siya nang bahala sa baby. Okay? Thank you. Totoo ba na pag nagbuntis yung babae, mas prone sila sa sakit ng fallopian tube? I cannot see the reason. Bakit prone sila sa sakit? What do you mean by prone sa sakit ng fallopian tube? The fallopian tube is mainly there as a passage for the fetus and the sperm and the egg. So pag nagbuntis, ibig sabihin okay yung nanay. Ha? Wala tayong problema. Ano pong gagawin? Kung nakalabas na yung ulo pero hindi pa po kasya yung shoulder during delivery. Depende, ha? Kung kaya namin at buhay pa ang baby. Kasi there are cases na pag buhay ang baby, nadala sa amin, hindi. Alam mo, buhay ang baby, what we do, yung doktora at saka okay, the size of the baby is maliit, no? I mean, kaya. Kinakat double episiotomy yung ginagawa ng doktor. Pasok yung isang kamay, pasok yung isang kamay. The doctor's hands will internally rotate the shoulder and pull the head. Pwede yun. Okay? Pero kung patay ang baby, useless. Lalo na pag malaki, that case na patay ang ulo nung nakalaylay, ang laki ng baby kasi 33 cm na, 39 pa na palabas, we did a cesarean in order to extract a dead fetus, which is not ideal. Okay? Okay? Wala na ba? As I said, milking of the cord is not anymore being recommended. We need to allow the cord to stop pulsating naturally. Milking the cord can produce pressure on the intraventricular meninges of the brain to rupture. So, hindi na. Bakit hindi na nag-iinema? Evidence-based, number one, they found out that it was not really effective. Okay? The more na naglabatiba ka, the more na nagtatai ang nanay during the second phase kasama ang expulsion of the baby and so more prone sa infection. So, tinanggal na siya. Okay? What vaccines to prevent congenital anomalies? MMR vaccine is primary. Rogam is primary in order to prevent hemolytic disease. So MMR vaccines to prevent German measles, which definitely is congenitally anomalous. Mostly po nung duty kami, patient who underwent CS ay may with preterm labor. Yes. Pag severely premature o pag preterm ang baby, okay, pag preterm ang baby at high risk, we do cesarean. Why? We do not want the baby to be hurt, no? Kasi ang tawag nito, ang premature, ang tawag nito, malalambot ang buto. So pag yan nag-undergo ng mechanism of labor, the possibility of a brain damage or hurting himself is high. So pag severely premature ang bata or at risk yung bata, we do cesarean. This is standard. Naku ha, ako na ang nag-assess kung tama yung ginagawa ng doktor o hindi. At risk for aspiration, remember what I said, pakakainin natin ang nanay if normal ha. That means to say kung normal, wala tayong anesthesia na ibibigay. Risk for aspiration lang yan if we give general anesthesia to the woman. Remember, we only feed women in normal labor. Okay, frozen eggs can be harvested anytime. The best time, of course, is within the reproductive age, 18 to 35. Okay? To freeze the eggs. Expensive siya, totoo, kasi you have to pay for the rental. Tapos, what age of women? Basta within the ideal. Para ma-freeze siya. Kaya ka nag-freeze kasi hindi ka pa sigurado na gusto mong mabuntis. So naglalagay ka doon ng possibility. Another is, kaya ka nag-freeze, you are not yet ready at this time. Okay? So, hinarvest mo ang itlog which is at the best health between 18 to 35. Ngayon, nag-decide ka magbuntis at 40. So, the egg is 30 or 25 years nung hinarvest, no? Tapos i-implant sa'yo na 40 na, better yon. So, pwede siya. Okay? Uy, if at 55, nawalan ng regla for 3 years, tapos meron na naman, that is not correct. That is not menstruation. That is bleeding. Maliwanag? Oh, menopause ka na, ha? 55 years old, 1 year ka na, etc. Aba, nung 58, nagkaroon ka uli. Uy, matakot ka na. Dalhin mo na siya sa doktor. Because that is dysfunctional bleeding and we are looking at a possible cancer. No? I-rule out ko na yan for cancer. Okay? Okay. Thank you, my dear. So I hope I have answered. I have answered more or less. O yung ano ha, 48 days ang cycle to 50 days ha, sobra na yon ha. Hindi, paayos nyo pa rin. Lahat ng libro, basahin nyo. Okay. As I said, administrative order ng DOH disregards or does not recommend priming sa lying in. Pero kung talagang pumupunta sa inyo, it's better na i-provide yun na kesa hindi siya pumunta sa ospital. Pero pag yan malapit na, talagang itulak mo na siya o dalhin mo na siya sa ospital. Are we clear? Okay. Ay nako, ito lang ang i-assume natin. Pag riniregla ka, you assume nag-o-ovulate ka. Now, if you want to be assured na talagang nag-o-ovulate ka, ipa-Grodens method mo yang iyong regla. Ipa-regular mo para sigurado. Okay? Uy, ang dami na. Sino to? Feds! Feds!
Yes, ma'am. Opo.
Sige, marami pa. Kaya lang, I have to go off kasi darating na si Ma'am Lucy, tama ba?
Yes po, ma'am. Opo.
Okay, my best friend will take over. So I'll see you tomorrow. Don't worry. Na-notice ko, Feds, they can answer mainly the questions. Yung concept lang nila kung minsan baluktot. At yung mga questions nila, natatawa ako dito. Hindi naman related dun sa question kundi related sa mga experience nila, related sa mga naramdaman nila at saka yung mga sa kapitbahay nila. But this is a good thing because I am correcting misconceptions. Okay? And so with that, my dear nurses, I'll see you tomorrow. Bye-bye.
Thank you po, ma'am. Happy lunchtime
Thank you.
po.
Yes, I will. Maraming salamat.